We are live on YouTube.
No, I'm good. No, I'm good. I have water. That's all I need. We're good.
So that they know they're. Yes. So say anything inappropriate.
Yeah, everything looks good.
We're not seeing it on,
Wait 1 second, I'll double check here. Yeah, no, I'm live on YouTube. I can see it on our YouTube page, it's fine.
it's on our YouTube
Yeah.
page?
We have, EPH yet, though.
She's joining by video. Do you have telephone info for her? Let me see if I do.
Okay. Do you see Karen's email? For 6.10, Jeff for 17.
Because you'll have to unmute them, right?
Yeah. Dr. Reed is that.
Good.
How are you, Dr. Lou?
Doing well. Just gonna test my audio. Can you hear me?
Very well. That was an exceptionally large mug you were just drinking from.
I believe this is a fairly normal sized mug if you want a closer inspection. I think it's just the angle of the.
Gotcha. It's the perspective.
And it is water.
I'm sure.
We're going on Shaw in 1 minute and 30.
Rachel, I think we should jump the LGBTQ2SI proclamation first before APH, don't you think?
Yes.
1 minute.
1 minute.
What am I missing here?
30 seconds to show.
We're missing Shoemaker, Dufour, and Scott.
They're not in the queue. We're live on Shaw.
I want to welcome everybody to our July 13th council meeting. Based on the announcement made today by the Premier, I'm hopeful this will be our last virtual council meeting. I expect, depending on the feedback from the CAO and work staff have to do that, we will likely be able to be in and broadcast from our council chambers at our August meeting. I want to thank all of our broadcasting partners and our media partners for broadcasting and reporting on our meeting, and ask the clerk to start the meeting, please.
Okay. I have a motion by Councillors Dufour and Nero, resolved that the minutes of regular council meeting of June 29, 2020 be approved.
All in favor? Motion's carried.
And under agenda item 3, declaration of pecuniary interest, Councillor Shoemaker has a conflict with respect to agenda item 6.2, the tender for LED lighting upgrades at the GFL Memorial Gardens, as the successful bidder is a client of the law firm. He's also declared with respect to agenda item 6.15, economic growth incentive program, Agua Canyon Tour Train Building, as the recipient of the grant is a client of the law firm. And with respect to the cycling lanes, line painting and pavement symbols contract, because the contract is being awarded to a client of the law firm. And I have no other declarations of pecuniary interest.
Council, does anybody else have a declaration they haven't submitted to the clerk? Seeing none, we can move on.
I have a motion by Councillors Bezo, Allen, and Booney, resolved that the agenda for July 13, 2020 City Council meeting as presented be approved.
All in favor? Motion's carried.
And agenda item 5.2 is a proclamation with respect to Pridefest week.
So I will read that now. I want to thank Councillor Hilsinger for her assistance in working with the community to organize this proclamation. And I think, are we going to call up the report, Mr. CEO, on the crosswalk at this time, or deal with it just in consent? We'll just deal with it in consent. You're on mute, Mr. CEO.
Sorry about that. I think, Mr. Mayor and Council, we can deal with it in consent, just given the gravity of our next presentation.
Okay, so I'll read the proclamation. Whereas queer and trans people are vital and valued members of our community, and diversity, acceptance, understanding, and inclusion are core values that we seek to attain, uphold, and promote. And whereas we recognize the importance of inclusive opportunities, a more visible LGBTQ2SI community, and the freedom to express oneself without prejudice. And Sault Ste. Marie celebrates the diversity that strengthens our city, including individuals who identify as lesbian, gay, bisexual, transgendered, two-spirited, and all other sexual orientations and gender identities. Whereas the Rainbow Pride flag is raised to honor LGBTQ2SI community members of Sault Ste. Marie and Algoma. Whereas the importance of creating safer spaces, developing allies, and eliminating homophobia, transphobia, and biphobia cannot be understated, and we seek to ensure the well-being of all members of the LGBTQSI community, their families, and their friends. Whereas Pridefest is an inclusive week for everyone in the community to come out to support, celebrate, and enjoy the many events and activities that focus on education, awareness, community development, creative expression, and fun for the whole family. Now therefore, I, Christian Provenzano, as mayor of the city of Sault Ste. Marie, do hereby proclaim July 9th to July 26th, 2020 as Pridefest week here in Sault Ste. Marie. And I encourage all citizens of all orientation and identities to join together in this celebration. Thank you. Councillor Hilsinger, did you have anything you wanted to add, or did you have any information you wanted to provide?
Thank you, Mr. Mayor. I just wanted to clarify, I think you said July 9th to the 26th, but it's actually the 19th to the 26th is Pride Fest week. And while this proclamation refers to many opportunities for people to gather and celebrate the week, I know that Soo Pride and others are working on alternate ways of sharing the message and providing support and gathering people. And I'm sure we'll all be hearing about them soon. And we look forward to the opportunity to raise the rainbow flag as well as part of this Pride Fest week. So thank you.
So but we'll be doing that. We'll be raising the flag, and the week is July 19th to July 26th. But thank you, Councillor Hilsinger. Okay, Madam Clerk, we can move on to 5.1.
Under agenda item 5.1, Algoma Public Health COVID-19 update, Dr. Jennifer Liu, Associate Medical Officer of Health, Director of Health Protection, is on the teleconference.
So welcome to Council, Dr. Liu. Council, we're going to give the floor to Dr. Liu. She's got a substantial, informative presentation. We'll let her go through her presentation, and then I'll take questions of Dr. Liu, and then we can have a discussion subsequent to that. So thank you. We appreciate your time very much, Dr. Liu. And before I let you start, I just want to thank you for the tremendous amount of work that you've done and Algoma Public Health has done over the last number of months to keep our community safe and healthy. We've been successful here in Sault Ste. Marie and in Algoma, and a large part of that is your leadership and the leadership coming out of Algoma Public Health, and I want to express my appreciation for that.
Thank you very much, Mr. Mayor, on behalf of the team, and equally thank you to yourself and the councillors and the great staff at Sault Ste. Marie City, which have been really hard at work throughout these past few months. So I'm just going to share my screen, and hopefully you will all be able to see the slides, and you're still continuing to hear me clearly.
We are, you're very clear. Just before you go, Madam Clerk, I noticed the presentation isn't on my agenda. Could you have someone circulate the presentation to the councillors, you know, if not right now, subsequent to that, so they could all have a copy of it?
Certainly.
Thank you. Go ahead, Dr. Liu. We can see your screen clearly.
Okay, great. So as requested, I'm here today to discuss masks and face coverings as part of strengthening our first line of defense against COVID-19 to Sault Ste. Marie City Council. I'll first speak to their use and their evidence of effectiveness, and then I will speak to our current landscape in terms of policy options for encouraging their use at this time. So with regards to the pandemic response, I want to remind everyone that there are really two simple goals in the response to the pandemic. The first is to minimize serious illness and death, and the second is to minimize societal disruption and preserve healthcare services. These require a whole of society response. And to be clear, the goal is never 0 cases. If that were the goal, we could all stay in lockdown forever until the virus is eradicated from the planet. But what we really want to do is to minimize harm to health and well-being in both the immediate and long term. And this means minimizing societal disruption. So we all know how very vital it is to protect our healthcare capacity. Our healthcare workers are so crucial to this response. But I also want to flag that our healthcare workers are actually the last line of defense when it comes to the COVID pandemic. We really want to avoid getting to the stage where we are sending people to the critical care system, to our ICUs, and to our nurses and doctors there. In fact, our first line of defense is Algoma residents. It's you and me. There was a survey recently done by Ledger 360 that said that 80% of Canadians believe that each of us individually has a responsibility to take action to prevent a second wave of COVID. And so Algoma's first line of defense so far has been fairly effective. We've all stepped up. We've all followed public health advice in terms of staying home at the very beginning of the pandemic. performing good hand hygiene, avoiding close contact with those outside of our immediate households, and doing physical distancing. And with all of these efforts, our curve has continued to remain flat. And in terms of where we are now, as the province continues to reopen, it's important to remember that all the preventive measures that we put into place are tried and true methods that have long been in place in our occupational health settings. Whenever we think of a hazard, we think of the hierarchy of controls, with the most effective being elimination of the hazard, physically removing the hazard completely from the environment. And where that's not possible, substituting. And where that's not possible, using engineering controls, administrative controls. And lastly, because it's the least effective method, using personal protective equipment. So when we think about the COVID virus and the fact that the host is people, at the very beginning of the pandemic, we did use elimination. We tried as much as we could to physically remove people from the environment. We asked everyone to stay home as much as possible, to stay out of the workplaces. We used substitution to go to work remotely, virtually. So these were the initial steps of the pandemic response. And then gradually, as the province began to reopen some workplaces, we also put in some engineering controls and said, okay, there are now more people out and about, back to work. We still need them to stay apart and be physically distanced from one another. And again, as the province continues to reopen, and just today announced the transition to stage 3 with even more opportunities to gather, it's ever more important that we continue to put in preventive measures in place. So administrative controls like staggering breaks or shifts, and eventually using personal protective measures such as masks and face coverings. So in summary, these are our tools that we have at our disposal in terms of the first line of defense against COVID. Staying at home, that's always an option, especially if someone has symptoms. Avoiding close contact with those outside of our household or exclusive social circle of 10. And I want to re-emphasize that even in stage 3, the social circle of 10 does not go away. The limits on gatherings will be increased, but for close contact, for physical contact, it's still limited to household and that social circle of 10. We physically distance, we wash our hands, we don't touch our eyes, nose, and mouth. And if we can, we wear a face mask or face covering. So why now, when we have very few cases? I've heard this very often. So the risk continues to be present. As you can see from the daily epidemiologic updates from the province, the coronavirus continues to circulate widely, and any close contact is a possible exposure. There are ongoing cases, over 100 every day still in Ontario. And concerningly for us, there are ongoing cases in the US. They've seen a rise in cases, and this includes Northern Michigan as well. So with stage 3 of reopening, there will be even more opportunities for people to travel, to gather, and this increases the risk of close contact and exposure. Now, we don't want to backtrack. As per the first two goals of the pandemic response, we want to minimize societal disruption, right? So we want the province to reopen safely. And in order to do that, we're trying as best as we can to put all the preventive measures in place. What we don't want to see is what has happened and continues to happen across the province, that outbreaks are occurring here and there, and not just in the Greater Toronto area. These are from health units not in the GTA. We've heard of the Kingston outbreak associated with the nail salon, where hundreds of people had to be contacted. There have been workplaces and employers spending hundreds of thousands of dollars to isolate workers, shutting down, having people go home. These are things that we want to avoid as much as possible because we want our local businesses to reopen and stay open. So Last Friday, as you know, Algoma Public Health introduced instructions to our local businesses and organizations that everyone needs to have a policy in place to require the wearing of masks that cover the mouth, the nose, and the chin in all enclosed public spaces. I'll speak more to those instructions at the end of the presentation. But at this point in time, beginning this Friday, which is coincidentally the day of stage 3 transition, we will have a requirement in Algoma that in all public places that are indoors, people should be expected to wear a mask. So to give us a bit of an overview on masks, there are medical ones and non-medical ones. So medical masks you've seen in surgeons, in the OR, when you go to the healthcare setting. Medical masks provide, firstly, source control. This means that it prevents the spread of respiratory droplets from the healthcare worker to vulnerable patients. Medical masks also protect the wearer, so the healthcare worker, from contracting infection from sick patients. So it works both ways, as source control and protecting the wearer. And importantly, they are medical devices that are regulated by Health Canada. The current guidance from both the federal and provincial governments is that medical masks should be conserved for our healthcare workers in the healthcare setting, remembering that they are our last line of defense against COVID. Now, non-medical masks, cloth masks, face coverings, they also provide source control. That is, they prevent the spread of respiratory droplets from coughing or sneezing or talking from the person wearing the mask to others. But they have not shown to be effective in protecting the wearer, and they are not medical devices, so they are not a regulated product. What is the evidence? So again, non-medical masks can reduce the expulsion of respiratory droplets into the air and onto surfaces. Last night, someone just sent me a really great Bill Nye the Science Guy YouTube video showing him demonstrating how that works with blowing out of a candle with different masks on. Google it, you'll find it. As I've said before, masks have not shown to be effective in protecting the wearer when they are just cloth masks or non-medical masks. But if I wear a mask and you wear a mask, my mask protects you, your mask protects me. And even if masks are only moderately effective, modeling studies suggest that if they are widespread in being adopted, so for example, 80% of the population, this can reduce COVID-19 spread. And these are very, very recent studies, some of which have come out in mid to late April this spring. So what are the policy options that are available to us if we want to encourage and promote the use of masks? So at the provincial level, currently we have a state of emergency and there are provincial directives and orders that can be issued. So for example, the Chief Medical Officer of Health in Directive number 3 does direct that healthcare workers in long-term care homes and retirement homes must wear a mask, and this is a medical mask, for the full duration of their shifts. There is currently no broader provincial directive for the general public to mask. Under the Health Protection and Promotion Act, which is Ontario's public health legislation, medical officers of health do have something called a Section 22 order that can be issued. And earlier on, we did see several health units use a Section 22 class order in order to make and enforce the wearing of masks in public places. This happened in Wellington, Dufferin, Guelph, just as they headed into stage 2. This happened in Windsor Essex County Health Unit. Remarkably, they've had a lot of outbreaks related to the agricultural sector in Windsor Essex. And so that was very much tied into their response to the farming outbreaks. And then of course, Kingston, Frontenac, Lennox, and Addington, KFL&A Public Health, and Middlesex London Health Unit also issued Section 22s under the authority of the Medical Officer of Health, as they were having challenges with outbreaks, one with the nail salon as previously mentioned, and Middlesex London with a lot of gatherings of young people who are not respecting the rules with regards to the social circles, nor the actual limits on gatherings. More recently, a lot of the health units have used our ability under the emergency order to issue instructions to local businesses and organizations. So under the current regulation of the emergency order, general compliance is required by businesses and organizations permitted to open. They are required to follow the advice, recommendations, and instructions of public health officials. And as such, local health units use this to issue formally instructions to businesses and premises to mask, to have a policy for people to mask in those settings. There, I've listed a number of health units who have already adopted or are in the process of adopting public health instructions for the general public to mask in enclosed public spaces. And I can say that there are quite a few more health units that will join that list in the very near future. Of note for this council, municipal bylaws have also been passed. The City of Toronto, Municipality of Waterloo, and Town of Caledon, and I believe a number of regional municipalities are also about to consider them at their council meetings as well, particularly in the GTA. Now, in some instances, bylaws have been in effect in conjunction with, for example, a Section 22 order, as is the case in Guelph, for example. In other situations, it's the municipality that's gone on ahead to use that as the policy option of choice. There are some advantages and caveats to this approach. Obviously, in terms of enforcement, if it's a municipal bylaw, then it is up to the municipality to direct the resources to enforce. And in consultation with a lot of Algoma municipalities, while we've seen an incredible amount of support for increased masking and our instructions, there was not necessarily sufficient resources across the board for enforcement and implementation. On the other hand, the instructions that are issued under the state of emergency are there for as long as the state of emergency and those regulations are in effect. And so there is an element of greater control on the municipalities end if they choose to pursue a municipal bylaw, so that even if all the emergency orders were rescinded, the municipality can still have control over where, when they choose to remove this particular requirement if they choose to adopt it. Other limitations would include the usual restrictions with regards to jurisdiction. So places that are under federal or provincial jurisdictions would not necessarily fall under the municipal bylaw. For a good example of a bylaw, the ones that are listed are up on these municipalities' websites. And then, of course, premises can have individual policies. So, for example, already visitors to the Sioux Area Hospital and Group Health Center are required to mask. In general, a mask is low cost, reusable, non-invasive. We know that based on modeling studies, if they are used widespread, they can help reduce COVID-19 spread. They also have an effect that can be a visual cue to maintain preventive behaviors and reduce complacency. Some challenges to bear in mind. So masks have to be worn properly to work. They can't be hanging off your chin or in one's pocket, and they have to be put on and put off in a way that avoids contamination. Very important to note that some groups cannot wear masks and that these groups should not be stigmatized. In our particular instructions, the wording and language we've chosen is very consistent with what other health units have done. So children under 2, people with breathing difficulties, communication challenges, all of these folks should not be forced to wear a mask and should not need to provide proof of exemption. And then, of course, masks are not enough. We still need to physically distance. We still need to avoid close contact with those outside of our social circles. Private gatherings until Friday are limited to 10, and then of course they can increase, but with physical distancing in place. So to wrap off, I'll just walk us through the instructions that were issued on Friday by APH to businesses and organizations. So firstly, the requirement is to adopt a policy that requires all members of the public and employees who enter or remain in an enclosed public space of the business or organization to wear a face mask or face covering that covers their mouth, nose, and chin without gaping. An enclosed public space means indoor spaces of businesses and organizations which are accessed by the public. As part of these instructions, we also very clearly listed some exemptions. The idea is not to make people's lives difficult. The idea is to promote masking as much as possible and to make sure that groups are not stigmatized. So the following people are exempt: children under 2 years of age, or children under age of 5 years, either chronologically or developmentally, who refuse to wear a mask or face covering and cannot be persuaded to do so by their caregiver. So parents, please don't freak out if your child is not having it that day. We have included this language because we know this will happen. Persons with medical conditions who cannot safely wear a mask or face covering, for example, breathing, cognitive, or communication difficulties. People who cannot wear or remove a face mask without assistance. And we want to make sure that these include people who are accommodated under AODA or are protected under the Human Rights Code in Ontario. And then, of course, in workplaces, which already have a lot of preventive measures set up, like plexiglass barriers, employees who are behind a physical barrier do not need to wear a mask. Temporary removal of a mask or face covering is permitted. For example, for athletic or fitness activities, water-based activities, consuming food or drink, any emergency or medical purpose. And just later today, we are going to update it to include receiving services. So before Friday, facials and services to the face in your nail salons and parlors are not yet permitted. They will be permitted in stage 3. And so obviously, if you're getting a facial, ladies, or if a gentleman, you're getting your beard groomed, removal of the face mask will be necessary for these services to be provided. So that's the first part, to have a policy to make sure there's appropriate exemptions and permissions for removal. The second part is to implement and enforce the policy in good faith and to use it to educate people on mask and face coverings and promote their use. So firstly, do not require employees or members of the public to provide proof of exemption. These people should not be discriminated against or stigmatized for not being able to wear a mask. The second requirement is to post signs to make sure that people know that masks are required, and to make it easy, we have sample signage available on APH's website. In terms of people who show up and they don't have a mask, our instruction is to give verbal reminders of the masking requirement. That is the extent to which we are recommending enforcement. Businesses, if they so choose, can wish to adopt a policy that is more stringent, but from a public health standpoint, we are asking that at least verbal reminders be given, and that is all that we require. We want workplaces to train employees on the requirements of their particular policy, and upon request, provide a copy of the policy to a PHI or anyone else who is authorized to enforce the EMCPA. So for the past week, our team has been working quite hard to provide what we call implementation support. We know that businesses have already been asked to do a tremendous lot of work in order to open and reopen safely. So we've done our best to provide supports in place to make this as easy as possible for local businesses and organizations. So we're making it the default. So all businesses and organizations should have a policy in place requiring masks and face coverings with some exceptions. We also want this to be easy. When we sent out these instructions, we also sent out a sample policy provided by APH, and this is also available on our websites. If businesses and organizations want to make it easy for the public to wear masks, They can choose to provide masks to employees, clients, or customers. They are not required to do so. There are many models that are possible for providing masks to customers, clients, or employees. You can use branding, swag, or even a cost recovery model similar to plastic bags. We're making sure that there's education and training available. So there's a frequently asked questions and resources available on our website. And because we're requiring signage to be put up, our website also has a number of signs that are available to download and print. So that is what's required of businesses based on APH's instructions. And our message to the general public is simply this. The novel coronavirus is still circulating in Ontario and increasingly in the US. Algoma residents make up the front line of defense against COVID-19. If you can, you must wear a mask in indoor public spaces. The mask or face covering should cover your mouth, nose, and chin without gaping. And doing this on top of physical distancing and avoiding close contact will help protect the health of our community members and importantly, help our local businesses reopen and stay open. So that is all I have prepared for council today. Very happy to take questions.
Okay, thank you, Dr. Liu. That was very extensive. I think that was very informative, and a lot of people will have a better understanding of the initiative that Algoma Public Health is rolling out here. So I'm going to take questions. People are texting me, so I have a lineup here of counselors, but if any other counselors are interested in asking questions, you can just put your hand up too, and I'll note that. I have Councillor Nero now and Councillor Christian, but I'm going to start on my list, and Councillor Hilsinger is the first one on my list. I see you, Councillor Vezavallen, too.
Thank you, Mr. Mayor. Thank you, Jennifer, for that very informative and educational presentation. My question comes through a resident who contacted me with regards to her concerns as it relates to people who are hard of hearing and that difficulty in communicating, not because they are wearing a mask, but because someone that they are trying to communicate with may be wearing a mask in a public setting, and their ability to read lips to understand and communicate is removed when that person is wearing a mask. Do you have any further guidance or help around that particular situation?
So thank you for raising that, Councillor. This is something that we're mindful of as well. An easy approach would be for those who do rely on communication and to be able to read lips, that they are able under the AODA to request for accommodation in public settings when they're being provided services. And as employers and service organizations, we are obligated to provide services and accommodate. So this is very important that we continue to recognize this. And for many service organizations and businesses, we know that to be able to see people's faces is very natural. And so for this reason, as much as possible, we have encouraged, and many places have adopted the use of the plexiglass barrier so that, you know, your grocery cashiers, your bank tellers, our APH frontline clerical staff are all able to still be seen and visible with their face behind the barrier. So those are some more of the engineering and administrative controls that we're putting in place. And lastly, all week long, our comms team and our Healthy Workplaces team continue to receive feedback. And so that concern is helpful for us to know. We continue to push different messages on social media to advise people of the accommodations and what they should do in order to navigate this new normal.
That's it. Do you have another question? Do you have a follow-up, Councillor Hilsinger?
No,
Okay.
thank you.
The next on my list is Councillor Gardy. Councillor Gardy.
Thanks, Mr. Mayor. Sorry, I just had to unmute myself. One question emanating out of your presentation, I had a couple that I had jotted down earlier. Did you say that those who are working behind a barrier in an establishment would not be required to wear a mask? Did I understand that correctly?
Yes, so that is one of the exemptions that we have listed. So for example, in an enclosed public space that is accessible to the general public, if an employee is behind a physical barrier, they could be exempted from the masking requirement because the barrier is the plexiglass as opposed to the mask itself.
Isn't part of the reason for wearing the mask, though, to reduce the amount of droplets that could be in the air, whereas the barrier itself wouldn't necessarily be something that would aid in or hindering, minor droplets, that there are some studies that say that they could linger in the air longer than some of the larger? Could you comment on that, Dr. Liu?
Sure. So the question, I believe, is, the role of the mask in source control, whereas if you're behind a barrier, theoretically, droplets can still fall onto a surface. So at this point in time, the WHO, as well as a number of organizations, continue to examine the evidence carefully with regards to transmission. So as you've all seen in the media, there are ongoing concerns as to whether, for example, airborne and aerosol transmission is possible. At this time, the guidance from Public Health Ontario, which is our scientific and technical advisory body, is that in general, the vast majority of transmission is contact and droplet. In particular settings where aerosol generation happens, so this is specifically in healthcare settings, certain procedures that will be very invasive. Those settings require the use of an N95 mask because there is a risk of generating aerosols into the environment. At this point, however, with this instruction to the general community organizations and businesses, the point is to prevent droplets from coming into contact with the general public. So whenever there's a physical barrier erected, that goal has been achieved. Of course, our public health inspectors are quite enthusiastic in reinforcing the adequate cleaning and disinfection of those barriers as well.
Thanks.
Is that it? Do you have anything else, Councilor Gardy?
I do.
You go on.
Thanks. Dr. Liu, I was just wondering if you could comment and appreciate these, what I've read isn't coming out of Ontario, it's coming out of some other kind of international journals. And I was just wondering if you could comment on some studies that have talked about the viral load in asymptomatic and pre-symptomatic patients, if you will, or individuals being much more potent than initially thought. Would you be able to comment on that? I think it's important just to give the context of another reason or reasons as to why masking may be so important.
Sure. So I'm not familiar with the precise studies that you've come across, but I can certainly speak to what we know based on evidence so far that Public Health Ontario and other agencies have accumulated. So we know that when a person contracts the virus, it takes a little bit of time, the incubation period, for the virus to grow and replicate inside that person and for that person to eventually become infectious. We know that a person can be infectious 48 hours before they show any symptoms. That's what we call the pre-symptomatic period. And so far, studies show that viral load during that time period is high enough for infection to occur and is generally what we would consider high in that period of time. When a person is asymptomatic, that means they have no symptoms. We believe that it's, rare for a person to have a truly asymptomatic course. However, it is possible, it has been observed, and to what extent that is responsible for transmission is still being elucidated by studies. We also know that a person can recover and still have this for a long period of time. Now, in those cases, the viral load is typically low, and studies have not shown that virus to be viable. So if it was, for example, found in testing, it could not be subsequently cultured. So there's a full spectrum of what is possible when a person first contracts the virus, has their course of illness, and then recovers. The virus typically peaks and rises to its highest load in that pre-symptomatic and then symptomatic phase, and it's most infectious then, and then it drops off. So we know that even if a person feels totally fine, maybe they're just pre-symptomatic. Maybe they might have symptoms a couple days later, but if they all of a sudden cough or sneeze, or someone else made them sneeze, there's a cat in the room, but they're incubating virus, they could be infectious. So it's these types of settings that general universal masking of source control would be able to provide us with further protection, because most people will stay home if they're ill. Most people at this point in time will not go into work. However, it's those pre-symptomatic and asymptomatic cases that we're concerned about.
Thank you. That's it.
Thank you, Councilor Gardy. I have Councilor Bruni next.
Thank you, Mr. Mayor, and thank you to Dr. Liu for her presentation. Dr. Liu, why wasn't this implemented, say, several months ago? Because I fully endorse the face masks. So I guess some people have asked me, why wasn't this implemented earlier?
Yeah, we've heard that question as well. And so I would say that several months ago was probably just the beginning of our response. And at that point in time, the policy of universal masking was not necessarily widely adopted, particularly in North America. There was not a lot of evidence to suggest that masking alone would provide as significant incremental benefit for it to be strongly recommended and adopted widely. And it was quite controversial, as many things are at the beginning of a pandemic. And also, the concept of a non-medical mask or face covering was also quite new. And there would not have been necessarily a large supply of this stuff early on. Medical masks we're quite familiar with, but we were not and are still not in a position where we have sufficient supply to recommend that everyone adopt medical mask use. We're still conserving those for the healthcare setting. So I would say that it's been a transition, as with the adoption of any policy. We've seen it done in a lot of jurisdictions in Asia. We've benefited from evidence from those jurisdictions, as well as from newer modeling studies. As I said, some of the studies I referenced came out in the springtime. So it's an evolving situation. And as with any policy that's widely implemented across the entire population, we want to make sure that there is an element of effectiveness, that it works before we ask everyone to do a thing. And also that we have thought through the potential side effects and repercussions, and are not necessarily, stigmatizing or not accommodating people who require it, such as the scenario that Councillor Hilsinger provided. So yes, we continue to learn and evolve and adopt the things that we find are effective.
Okay, thank you. And my second question is, can face shields replace masks?
Heard that one too. So face shields, for some of you who've not seen them, usually involve a kind of headband and then a clear plastic covering that comes straight down the face. At this point in time, we don't recommend that face shields be used alone in place of a face mask, particularly for people who can wear a face mask. This is because source control relies on covering the nose, the mouth, and the chin without gapping in order to provide adequate coverage and really to catch that sneeze. So face shields, as they're currently designed, don't necessarily catch all the droplets because they do have a gap at the bottom. Personally, I think it's only a matter of time before innovation in this sector provide us with, alternatives that, again, allow for the face to be more visible and provide, the coverage that's required for source control. So at this point, for those who can't tolerate an actual face covering, if they choose to wear a face shield, totally fine. For those who can wear a mask, that is what we recommend.
Thank you very much.
Is that it for you, Councilor Bruni? So Councillor Hollingsworth, please.
Thank you. Unmute. Thank you, Dr. Liu, for coming back to council to educate us on this topic. And I also want to use this time to thank not just yourself, but all of your team and our healthcare workers. You touched on, again, if you're in a store and the cashier has a plastic barrier, and that individual, you said, does not have to wear a mask. So if the customer is there and there's no one else around, can that person take off their mask since there is a plastic barrier between the cashier or the bank teller and the customer?
Thanks. So yes, another unique situation. So again, we leave it to the business and the organization to adopt a policy. That is the basic instruction. Adopt a policy. These are the exemptions, and these are, the specific situations where temporary removal is permitted. Just today, we're adding a clause that says temporary removal is permitted for receiving services. So again, I think what you mentioned is probably a low risk situation. But again, it's up to the business to decide if that's going to be okay. So if they're a small mom and pop and the space is such that they only allow one person in at a time, is that okay? We're continuing to work with all of our partners locally and organizations to find a solution that works for them. In general, we do recommend a kind of blanket policy in place that requires masking in those enclosed public settings, because it's hard to predict who pops in. But there are exceptions, of course, that can be made.
Okay. My other question is, can you dive in further to the definition of public indoor space? Give you another example. A person's in a bank and they're in their account manager's office negotiating their mortgage, for example, or they're in their lawyer's office and they're in a meeting with their lawyer or two lawyers. Is that still considered an indoor public space? And hence, would all those partners that I mentioned have to wear a mask?
Yeah, thanks again. So in general, we define the enclosed public spaces as indoor spaces that are accessible to the general public and are accessed. So in a lot of situations, there are kind of spaces where clients can go into. And for those spaces, it's up to the business to determine what kind of policy they want to have in place. It's really for the general areas that are accessible by the general public without further kind of staff letting them into those spaces that we're concerned about.
Okay. So now that we're going to stage 3, which is very positive for our community and obviously for all of Ontario, does this mean that we may be able to have concerts now? However, we have to wear masks, but still can enjoy a sporting event, a concert, and so forth?
So thanks for that question. And I have the stage 3 framework right here because it just came out. So, on page 16 under live shows, performing arts and movie theaters, it does say that concerts, artistic events, theatrical productions, performances, and movie theaters may resume operations subject to a number of restrictions. Importantly, there has to be physical distancing that still is maintained in those settings, and they cannot exceed gathering limits of 50 indoors and 100 outdoors. There's a number of other restrictions as well. But those are part of the stage 3 permissions.
Okay, so that may help our Agoma Fall Festival with Councillor Hilsinger's creativity. That could be a real positive for us and possibly for our tourism, local tourism. So that's good. I do have 2 other questions if you don't mind. Can you just touch base again on the matrix that Agoma Public Health used to determine why our community, our area of Agoma is adopting the mask policy? What matrix did you use?
Sure. So at this point in time, everything begins with a risk assessment. And so as I covered during the presentation, the risk is ever present. We continue to have sporadic cases within Algoma We know that there's 100+ cases every day in this province and that people are traveling freely. We're also very much connected to Sault Ste. Marie, Michigan, Chippewa County, and they're starting to see increasing cases as well. So the risk of contracting the virus is still present, and it may, persist for a long period of time. On the other hand, we are opening and we're opening more. And so we need to put in additional preventive measures if we don't want to go back into lockdown, if we still want to protect people and encourage them to come out to support local businesses and attend a concert. These are some measures that we realize need to be put in place. Public support and the support of our municipalities is also important for our decision making. And so, throughout the last couple of months when these policies began to be introduced, we've been hearing very strongly from both sides, both people who strongly support and both people who have concerns about implementation. And so we took this time to really examine how other jurisdictions are progressing to make sure that when we do implement, we've taken into account hopefully most of people's concerns. We continue to hear from them and will change course as need be as stage 3 reopens. We're already updating. So again, the idea is to work with our communities as much as possible while maintaining as much protection as this can afford us.
Okay, just my second last question. Education, you said, is very important, which I agree with. Putting on a mask, taking off a mask is extremely critical. I'm watching them put the mask on, they're actually touching the whole mask as they take it off, and then they're rubbing their eyes. You probably don't have a mask with you right now to demonstrate how to properly put one on and take it off. And if you don't, can you comment on how often you should wash your mask, how often you should change it? Just like yourself and other counselors, I've done my research from public health, the College of Nurses, which I'm part of, and also the World Health Organization. And they mentioned that cloth masks should be minimum 3 layers as one thing. 2, you should be disposing your mask on a daily basis, as in like discarding it if it's a medical one. 3, if it's a cloth one, you should be washing it daily and make sure it's hung properly, because there's also some cons about increased risk of self-contamination if you're not handling it correctly. And there's also potential risk from infected person before they develop symptoms, and hence it could be on the mask and so forth. Can you comment on that?
Absolutely. Although I'll say that you covered it pretty well, and I'm happy to put that segment on our website if you'd like. So yes, with our instructions, we have provided links to sample policy, FAQs, as well as a video on how to wear a face covering properly. That's one of the most popular vids on our social media. It's gotten quite a few hits, and we kind of repush it regularly, and we have included it as part of the package for this document. We also recognize that care of masks and where to get one or how to make one are all very important topics. So they are included in our frequently asked questions as well, in terms of how to make a mask for those who are talented. I am not. For those who want to support local businesses, we actually have partnered with Sault Ste. Marie as well as the Innovation Center to provide a list of local suppliers of both medical PPE and non-medical masks. So that is also linked to our website where people can source them. And we're also aware of a number of really great groups locally across Algoma who are making masks and providing them for free. So as much as we can, we're finding out about them and linking people up. But yes, we continue to hear about concerns, and all through this week, our comms will continue to, based on feedback such as yours, push messaging on things like what to do and what not to do with your mask. So certainly regular washing and proper donning and doffing.
May I suggest one idea? I know your manpower, you're not, how can I say, you don't have a lot of manpower, but wouldn't it be nice for the next 2 weeks if you had a few people scattered throughout the city, the more popular areas, like at grocery stores, where a public health staff member can just say, hi, I'm glad you've seen you wear your mask. Can I give you friendly reminders on how to take care of it? I don't know if that's appropriate. I don't know if that's possible. I don't know if you have the manpower, but it's just an idea. And last question is false sense of security. Are you worried that this is going to give people the false sense of security and that they're going to stop washing their hands? You did comment on it, but I'd like to close off my question on that because we have to make sure both are done harmlessly at the same time.
Yeah, absolutely. We really don't want people to become complacent. I think masks work both ways in that regard. They're a nice visual reminder that we're still in the presence of a pandemic and that case counts are skyrocketing elsewhere very close to us. On the other hand, people can, as you said, have a false sense of security. So again, we are pushing very hard the messages that hand hygiene is important, as well as physical distancing. You know, with the opening of stage 3 and the increase of limits to 50 and 100, you know, we're very much cognizant of the key message that is still in there, which is your social circle should still be exclusive and limited to 10. And those are all the people that should have close contact and direct physical contact. So yes, very much aware that we cannot be complacent and we'll keep pushing the messages. I don't know if we'll have enough boots on the ground to give demos at your local neighborhood store, but we will keep pushing the messages.
If you need help on that, let me know, but keep on using your hand sanitizer. And thank you very much.
We'll call on you, Councillor, if we need boots on the ground.
Sounds good.
Councillor Nero?
Thank you, Mr. Mayor. Thank you for that presentation, Dr. Liu. My question, the first question is in regards to the public health instructions. As I understand it, the policy that begins on July 17th is that everyone that goes into a business or a premises wear masks. And through your presentation, I believe I understood that the only enforcement is that the business remind the client or person going into the business that masks are required. Is that correct?
Yes, so this is something that we've adopted and is consistent with the approach being used across the province by other municipalities and health units that we've spoken to. It is a minimum requirement of the instructions. Again, we're not necessarily interested in creating a barrier for local businesses. We know that they're there to do their business and not to tell people what to do about their masks and so forth. So that is all that is required from the public health instructions, and that if you enforce it in good faith by putting up a sign about your policy and by reminding people, that's fine. Businesses can choose to go beyond, right? It's their policy. They can choose to turn away customers if that is what they want to do, but we're not requiring businesses to do that. We know it's tough enough as it is with the current pandemic. So really it's up to the local premise to adopt an enforcement approach that they feel is appropriate for them and their premise, and then to train their employees accordingly.
Okay, I think you've answered the second part of my question. If a person comes in and says, well, no, I'm not wearing a mask, does the business have, through their policy, the right to refuse entry to that person? So it's up to the business to make that decision.
Yeah, I would liken it to, you know, currently I believe some businesses will probably refuse entry if you have an insufficient amount of clothing on for certain areas. So it's similar to that. Shirts, pants, shoes, masks.
Okay, thank you. My second question is what is your position as it relates to a municipal bylaw, as some other cities have passed? Is that a good move or is it not a good move?
So not being in your shoes, I would not know the extent to which Sault Ste. Marie is able to implement and enforce this particular type of bylaw, nor, you know, the extent to which you wish to enforce it. So again, on the area of enforcement, if it is the view of the citizens of the Soo and of this council that we're being too wishy-washy and that you want to come down harder on masking, the use of a bylaw is a perfect way to do so, so that, you know, if you want to have a harder line of enforcement or be more stringent or implement certain other criteria, that is unique and specific to the Sioux, very welcome to do so. And the municipal bylaw would be the optimal tool to be able to do that. Obviously, Algoma Public Health, part of our mandate is to be able to accommodate the needs of all of our 21 municipalities and be consistent with the rest of the local public health units. So that's the kind of fine line that we've tried to establish in issuing these instructions, recognizing that municipalities can choose to do so. I think, the concurrent presence of public health instructions and a local bylaw can really serve to send a consistent message to local citizens that this is important and should be adopted. But again, it is not a small matter to implement any policy. And so those intricacies I very much leave to the capable hands of city staff to consider.
Thank you, Dr. Liu, and thank you for all the fine work you've done throughout this pandemic. Thank you. Thank you, Mr.
I think Councilor
Thank you.
Christian froze, and there you go, Councilor Christian.
Oh, thank you, Mr. Mayor. And thank you, Dr. Liu. Again, I'll reiterate what the other councilors have said. Thank you for your leadership and APH's leadership in this. It's the reason why Sault Ste. Marie has the highest, or lowest rather, per capita incidence of COVID. It's no small measure in the work that you people have done. Most of my questions have been asked, especially the one that Councillor Nero just asked regarding a bylaw. My question is, I just want to be clear, although I think you've done a good job of explaining it. The requirement is that businesses have a policy and a practice in place. Hypothetically, and I don't wish to put you on the spot, but I'm just trying to frame this. What if there's the odd business that simply says, I find that this is too much, I don't want to do it? Is there a repercussion there, or is it simply a directive, guidelines that we're asking them to follow? Is there any penalty on business?
Sure. So the instructions that are issued are done so under the Emergency Management and Civil Protection Act. And those regulations allow for general compliance and following the advice and instructions of public health officials. The enforcement of the act can happen, in terms of things like social gatherings that theoretically a police officer could ticket, fine you if you gather in a group more than 10. I have not heard of the Sioux Police Force or the OPP actually hitting that measure. Usually the enforcement approach begins with education and typically ends with education. And again, we've done as much as we could to make it not onerous. The easiest route for a business that finds it very difficult and challenging to implement is to print the sample policy off our website, write the name of the business down, put up a sign, and tell people that they need to wear a mask. That's it.
And thank you, and I agree with you. And I think failing that, I think the general public could choose for themselves whether they want to frequent a business that refuses to have a policy in place at this point. My final question, again, most of my questions were asked. Is there any plan or any mechanism to take a sampling of the businesses to determine compliance by the general public? In other words, if we, for the next month or so, could take a sampling of businesses to say, find out how many people come in that aren't wearing a mask, just even if it's a rough estimate, that might help guide council in the future to determine if they want to put a more stringent bylaw in place because of non-compliance.
So that is a good and helpful feedback for us to hear, that if you had some data on hand, it would help inform your decisions. We agree, and actually are in the process of trying to find some ways to evaluate our messaging so far, including observing what's being practiced. They're in the early stages of planning, but we'll happily keep you apprised. We have been approached by various people who have made observations. Notably, I will say that a couple of really proactive students have shared with us some of their observations and suggest that at this point, less than 30%, in general, in some of the places that they've observed are masking. Of course, that does vary depending on where you go and the age and the premise and possibly the weather. But we are looking at doing a bit more data collection, and we'd be happy to share some of those findings if they inform your decision making.
I think that would be very, very helpful. And like any data collection, the sampling size does not have to be large as long as we get a good cross section. I think it would go a long way to guide council going forward should we face the idea or the possibility of having to implement a bylaw. Thank you very much.
Thank you. I'll bring it up with our planning and evaluation specialist.
Councillor Bezo-Allen, please.
Thank you, Dr. Lowe, for the presentation. Just three quick questions. We've taken up quite a bit of your time. Regarding the policy and signage, and you brought up small business. I definitely will share that with the Downtown Association membership. I'm on the Downtown Association board. Is there going to be a grace period in terms of, Friday opening, someone doesn't have a sign up or a policy in place, especially for small business owners? Is there someone specific that they can call at APH to assist with any questions that they may have, not printing off the sign and posting the sign? I mean, that's simple, but in terms of implementing the policy or how they need to perhaps tailor the policy for their business.
Yeah, absolutely. So again, included as part of the instructions that were issued, we also tell people that they can contact us at any point in time if they have questions or want some more consultation. So that's our Healthy Workplaces team, healthyworkplaces@algomapublichealth.com. They can also call us 705-942-4646 at extension 3276. This information is also on our website, and this has been part of the team's work throughout the pandemic response, actually, as the government continues to issue new guidance and new changes in terms of reopenings. People can call us at any time to try and figure out what's allowed and what should be put in place.
Great. I'll make sure I share that widely, and thank you. My other concern stems from people that may receive discrimination for not wearing a mask. So you did mention, people that have, respiratory issues. They may have a communication disorder. So there's a whole other side of that population that are covered under the Disability Act that may have sensory issues and that sort of thing. Is there sort of an education tool that that we can aid the greater public with? Is that if you see someone without a mask, how do you approach that and how do you communicate that? So, right now, Rome's is doing a great thing where, they give you a mask and, $1 gets put at the cash that's going to their children's charity. But, and I think it's a wonderful messaging, what they're doing at Rome's. However, if you have someone who, can't wear a mask, but probably physically looks like they should not have an issue with that, do we have some sort of social stories or some sort of communication to demonstrate that better, especially if you're dealing with persons that may have Down syndrome or autism spectrum disorder that have sensory issues?
Yeah, so thanks very much for that feedback. My understanding is that our comms team this week, as part of their push of messaging, will have a very specific arm to really counter some of the mask shaming and the stigmatizing behaviors that we hope will subside once that education is provided. So very much we're trying to make sure that these groups are accommodated and are protected from stigma in our communities. We're also looking and sharing experiences with other jurisdictions to see if anyone else has any clever ideas as to how this group can be accommodated in a way that is easy and acceptable and creates less barriers for all. So yes, thank you for that feedback.
Thank you.
Last is just on accessibility and affordability. So I know that you have on your website places where people can go to buy masks. Do you also have any information for people that need masks that aren't able to afford them?
So at this time, I don't believe we have any particular group that is supplying masks for free locally. We know that there have been initiatives that have popped up from time to time. I know a group has provided masks to the hospital for free. They've gone to grocery stores and different campaigns. But on a kind of ongoing sustainable basis, we haven't necessarily had a group who's able to do that on an ongoing basis. However, if there is interest locally, we're very happy to hear from any such groups and to give their information out.
Thank you very much.
Councillor Scott.
Thank you, Mayor Provenzano. A lot of my questions have been asked, so I only have one. It's in regards to, so this is for Dr. Liu. It's in regards to a question I was asked by a constituent. So when it comes to the mandatory or the suggested group of people to wear the masks, it mentions that areas where customers can't access, so places that aren't accessible to the public, they don't have to wear them. So I would assume that would be like staff in the back where, you know, customers aren't going to access. But the question that was asked to me was, what about like food handling? So kitchens, I understand it'd be very hot to wear it in a kitchen, but also if it's spread by droplet, would it not make sense that kitchen staff and staff that are handling food have to wear a mask?
Yeah, so at this point, based on the stage 3 reopenings, indoor dining is part of that reopening, and we're still in the process of looking at what the province is going to say and is saying with regards to personal protection in those settings. At this point in time, our approach to masking is really going to cover the public spaces and not kind of Ministry of Labor type areas of work and employees and so forth. But we're going to keep on looking at what the province intends for a lot of the stage 3 reopenings to make sure that any future guidance coming forward is consistent. But at this point in time, in our food premises, we would advise, you know, servers of the food certainly a mask, because physical distancing cannot be maintained when you're, you know, literally putting down a plate in front of someone. But we're not at the point of mandating masking in non-public settings because we're really trying to see the province come up with a consistent approach in consultation with Ministry of Labor for all those different and diverse settings.
Great. That was all of my questions. Everything else was already asked. So thank you for the presentation, Dr. Liu. It was fantastic.
Councillor Shoemaker.
Thank you, Mr. Mayor. Through you to Dr. Liu. Dr. Liu, would it be fair to say that we haven't heard the last on this issue from Algoma Public Health's perspective, meaning as new information or scientific evidence comes available, Algoma Public Health is going to respond to those that data and tweak its policies and guidelines and policies accordingly?
Yeah, absolutely. You know, I think as I've mentioned, you know, our position and our messaging today is quite a bit different than what it was at the beginning of the pandemic, when we didn't think there was transmission without symptoms, and we weren't sure whether masks are actually effective if they're non-medical masks. So as the evidence progresses, as the studies are being done, not just in North America, but in other jurisdictions, we continue to look at what is going to work and to really try and pick and choose the interventions that give us the biggest bang for buck, because we know that everyone's working super hard during this pandemic, and we want to spend our time and resources and manpower on the interventions that actually have the greatest effect and greatest protective benefit. We know that you know, the fall is coming, school is reopening. The latest deluge in my inbox is the evidence around, schools and transmission in kids and education approaches. So, all of those policies are being decided at the provincial level at this time, Ministry of Health, Ministry of Education, but it's never ending in terms of looking at the evidence, and it always is emerging thanks to the great scientists out there doing this work. So correct, not the last of it.
Okay, thank you. If there's any need for a council bylaw, as I think Councillor Christian or maybe Councillor Gardy noted, I think that the support is there for one if it's necessary. So by all means, we ask that you, and we know you will, keep us apprised of any steps we need to take to protect our community, because I think that's top of mind for all of us. Thanks for your great presentation.
Okay, Council, I have a couple questions for Dr. Liu, and then I was just going to make some comments. We've been on this for over an hour, and we've got quite a bit of an agenda left, so I don't want to go around the table again on comments, because it really was an educational session for us in the community at large. Dr. Liu, my two questions, one relates to restaurants. How would you conceive of that working? Like, would you see a couple that goes out for dinner having to be masked when they're at their table, or just masked when they enter the restaurant and exit the restaurant?
Yeah, so as it's currently written, and I have no qualms about telling you that we stole all our language from other health units, especially from City of Toronto, because they have a team of lawyers and we don't. And they also have many more restaurants than we do. So temporary removal of a face covering is permitted to consume food or drink. I think it's perfectly reasonable when sitting at a table that you're not going to doff and don between every course. Councillor Hollingsworth will tell you that's a prime opportunity for contamination. But it really is around assessing that particular premise. If they're a small space and you really just go in and sit right down, versus another premise where you might line up and be in the takeout area with a lot of other people milling about, then that would be a public space where you should keep your mask on until you're seated and able to enjoy your meal. So, that's kind of our approach.
And exercise, I think, is exempted. Is that correct? So if you operate a gym facility, you're not having people go there and keeping their mask on when they're working out. Is that the case?
Correct. We don't want to overburden our ERs any further.
Yeah. So, Council, from my perspective, there's a lot. This was just announced on Friday, and there's a lot to consider, and there's a lot for the community to adjust to. But one of the reasons why we talked to Dr. Liu and we put this on the agenda is because we wanted to see an increase in mask usage in our community. Now, I think it's important to note that the community's done really well in responding to Algoma Public Health's advice, and you see that, I think, in our numbers. But it's really important to keep on doing what we were doing to get us here, which is listening to Algoma Public Health. But if you really look at what Algoma Public Health is doing here, it's not a mandatory masking order in so much as it's a mandatory policy instruction. So Algoma Public Health is telling our businesses, like my own, that you have to have a policy. But this is not in any way heavy-handed or draconian. The reality is it raises the elevation and discussion of the importance of masking in our community. And I hope that the increased discussion on masking and businesses looking at policies and implementing policies will lead to more people masking when they're out and about publicly. I think the worst thing that can happen for the entire community is for us to slide backwards. No one wants to go back to March 13th, and no one wants to be in a situation that we were in 3.5 months ago. So I think this is a positive step, and I want to recognize that the way Algoma Public Health is doing this is very conciliatory, and it's very respectful of people's autonomy, and it's very respectful of businesses' abilities to implement a policy that is effective for that business. It's really a good faith initiative, and I'm asking the community to embrace it, to look at it, to do what you can to develop a policy that's reasonable for your business, and also when you're frequenting businesses, to do what you can to comply with that policy. And I think that we as council have to keep a close eye on this. We have to look to see where we can be supportive, and if we need to be supportive, and if we need another step then I think at that point it would be when we would consider passing bylaw. But I don't think we'll need that step to pass a bylaw if the community reacts to Algoma Public Health's advice and instruction here the way we have to date. And so that really is my hope, that the community will take this up, they'll see that it's reasonable request, and they'll follow the instructions, and the businesses will follow the instructions. And if we see a significant increase in mask usage, then we probably won't have to take the next step of implementing a mandatory bylaw. So I appreciate the time Dr. Liu took today. I appreciate the work that her and her staff put into this. And I'd ask the community to embrace this advice the same way that you've embraced the public health advice that we've got to date, which has put us into the position that we're currently in. I want to thank everybody that participated in this conversation and the councilors for all their good questions. And I want to encourage anybody to reach out to city councilors. If you have questions, they can help you get them answered. And reach out to Algoma Public Health if you have questions, and they can help you get them answered. And we'll continue to work together as a community to keep ourselves safe. It's important that we all realize this virus is not slowing down. We might have flattened the curve here in Sault Ste. Marie and Algoma and in Canada, but it is not flat in the United States. And they have days where they're recording more than 70,000 cases in a day. And that's a very real risk to our community, being a border city. And we have to recognize that although we have slowed our cases down here, the virus is present. There is no vaccine for it, and a full course of care has not yet been developed. So we have to keep on doing what we're doing. So thank you, Dr. Liu, very much. In lieu of any other questions councilors might have for staff, I'd like to move on to the next item in the agenda, to the consent agenda. There's no objection to that. Seeing none, Dr. Liu, we appreciate your time, and we will move on to consent. So we are on consent. I had a number of people text me before the meeting about consent matters. So the first one I received was from Councillor Christian. I'll start with him, and then we'll go to Councillor Bezo-Allen. So Councillor Christian.
Thank you, Mr. Mayor. My first issue relates to 6.3. I guess I would direct these questions to representatives from PWT. The purchase of the graders. And when you read the literature on this, it's talking about whether purchasing or leasing is the way to go. And I guess a couple of questions on this. The first one is, what is the useful life of this equipment? I see that usually I think we take out a 5-year lease. If we purchase the equipment, how long could we generally expect it to last? What is the hope?
To Mr. Mayor, to Councillor Christian, it is our hope, and we've had this in the past. We've had graders as long as between 10 and 12 years. That's our reasoning for looking at the purchase in this case. Okay. In the documentation, one of the reasons for purchasing is that you don't have to worry about going over all of the hours. Generally speaking, historically, roughly, we tend to go over our hours of usage in leases. Was that a mitigating factor? Through Mr. Mayor to Councillor Christian, no, not really. We usually stay within our hours unless we have a really excessive winter, like a few winters ago, we might go over a bit, but it usually weighs itself out over the next couple of years within the lease. So no, that wasn't any of the reasoning. What normally happens is when we go to make a purchase, something as substantial as this, we put it out for tender, and when they come in, we have that option of purchase or lease. And what we do is we have finance go through it and audit it and take a look at, see what our best options are. It just so happens in this case, at this time, graders, with these graders, there's approximate savings over a 5-year lease. So if you base that over that 5-year lease period that you'd be making it, right, you're probably saving in the area of $50,000 per unit. So we look at finance for that direction.
Okay. Mr. Mayor, I don't have any other questions on 6.3. Not sure if any other councilors have anything on that, but I do have a follow-up for 6.3.
I've got Councillor Bruni on 6.3. Go ahead, Councillor Bruni.
Thank you. Mr. Mayor, I guess this question would go to Shelley. How much do we have in the operational hired equipment operating account?
Through you, Mr. Mayor, to Councillor Bruni, I don't have that information handy. Is there something that you were directing that question in regards to that I might be able to answer offhand?
No, I just want to know what we have in the account there. That's all.
Are you talking about the total operating budget?
Well, the money's coming out of that account. Am I correct?
Yes, the money, what we'll be doing is financing it internally for the purchase. And then we already had the hired equipment operating account had $185,000 in it that we used to use for the leasing. So that'll be applied over the next 7.5 years to pay for it.
Okay, thank you. I appreciate it.
You're welcome.
Anybody else in 6.3? Okay, Councillor Christian, your next item.
Yes, thank you, Mr. Mayor. I guess to Mr. Girardi again, 6.4. Now we turn to leasing, and I think I know the answer, but I'll Girardi. It's the same process used here in terms of deciding whether we lease or buy, and it turns out that leasing is the best practice. Is that true?
To you, Mr. Mayor, to Councillor Christian, absolutely. Yeah, we do follow the same practice, and we have finance review it. Now, just previous on Councillor Bruni's question, our budget, our hired equipment budget is $865,000, just so we had clarification on that number.
Okay, on 6.4, Councillor Scott, I think you had your hand up. Yeah, go ahead.
Thank you, Mr. Mayor. Just a quick question to Mr. Girardi about this. Do you know the pricing of the initial tender that was selected? Was that in the report? Did I miss that?
The initial tender for the loaders?
Yeah, for the loaders. The one that didn't go through, the quote.
No, I don't have that information because it was pulled. The supplier could not provide the product that we're looking for.
Okay.
So at the price that they submitted. So I don't have that information.
Sorry, yeah, that's kind of what I was wondering is what the price submitted was. And was that going to be a lease or a purchase? That was probably going to be a lease, correct?
That was going to be a lease. So the loaders came in through on a lease. That's correct.
Okay, perfect. That was my questions. Thank you.
Are you done, Councillor Christian, or do you have anything else?
I have one more item, and it's 6.14. Financial incentive guarantees report. I see that Mr. Turco is the author of this. I don't know if he's present or Mr. McConnell is present to answer my question. My question is quite simple. I've been made aware of this program. As we know, it's been around for a few years, and I've always thought it was quite unique and innovative. I guess for the general public, my question is, when this was implemented, was it unique? Was it a first-time thing for Ontario? Were we the first to implement a plan such as this?
Mr. CEO, who's going to take that?
Don McConnell.
Mr. Mayor, I'm Don McConnell. I am on the line.
Okay, go ahead, please.
Thank you, Mr. Mayor. Through you to Councillor Christian. This program has been in effect for almost 10 years now. We're actually in our third version of it. And I believe, I mean, the legislation has been available for some time, but I believe we were the first municipality to actually give grants as part of a downtown development program. And it has been very successful. It's been copied by a number of other municipalities since.
Well, thank you very much. I've always been impressed by this program, and I just want the general public to appreciate that you know the city is working with the downtown to implement these changes. We're trying to incentivize people to upgrade the downtown, and I don't want the public to lose sight of that. So kudos to staff for implementing this, and I think it's a great program. Thank you.
Anybody else on 6.14? Okay, so Councillor Shoemaker and then Councillor Hollingsworth.
Yes, thank you, Mr. Mayor. Just a comment on this actually, which is that this is 4 or 5 objectives in our downtown revitalization that we're trying to achieve are being achieved with these improvements. So we're bringing groceries downtown, which have been lacking. We're bringing businesses back to Queen Street, which is an objective of our downtown revitalization plan. And we're bringing more office workers from uptown to downtown with the movement of Joe Risha's accounting office to the old Who Governs building. So obviously the incentive program is working, and kudos to all the applicants, including my good friend Greco at IDA for their proposals here.
Okay, Councillor Hollingsworth.
Sorry, just had to unmute. I just basically echoing Councillor Shoemaker's comments. Really happy to see the IDA coming down and more professional services. It's going to just add a positive energy and growth to our downtown. So, and I agree, this program is outstanding. Thank you.
Okay, so that's 6.14. Councillor Christian, we're going to move on with you. We're going to go to Councillor Lisa Bezo-Allen. Councillor Nero, I'm just going to ask you to take the chair for a few minutes. You're the acting mayor. So
Okay.
Councillor Lisa Bezo-Allen's on consent. It's her turn.
Anybody after that, Mr. Mayor?
Oh, I'll be back by the time.
Okay.
She's got a number of items. She has like 4 or 5 items.
Okay, thanks.
Thank you.
Councillor Lisa Bezo-Allen.
Thank you. Through you, Acting Mayor, I'm on 6.5, the destination marketing RFP. So either Mr. Ver or I also saw Mr. Anderson on the call. Of the 16 proposals that were received for the marketing, was any one from local marketing firms in Sault Ste. Marie in the Algoma area?
Through you, Mr. Acting Mayor, to Councillor Vesno-Allen. Yes, we did have at least 2 submissions from some local firms, and they were evaluated against the other proposals that we did receive, and you know, despite their best efforts, we're recommending to proceed with Duggan Partners.
Thank you, Mr. Anderson. And the time frame, I mean, I know it's a destination marketing, and I mean, right now is sort of prime holiday planning season. And so just wondering, what is the time frame of this marketing strategy?
To you, Councillor Vesno-Allen, the time frame is actually a fairly quick turnaround. So the actual scope of work includes not only a marketing strategy, but also the creative content for implementation. We're anticipating to have the strategy developed within 8 weeks, and then rollout of the new content shortly thereafter. We are really looking to move forward with you know, a number of the recommendations and implementation as we head into the fall, and gearing up towards a lot of the marketing that we're intending to roll out, both heavily focused on winter and also on our ongoing summer campaign. So there's a bit of you know, the actual development will include content for the summer, fall, and winter, which we'll be using throughout this year and into 2021 as well.
Okay, I don't have anything further on that item. Thank you, Mr. Anderson.
Is there any other councillor on this item?
I have a question, Mr. Acting Mayor or Mr. Mayor.
The mayor is back.
I'll let Councillor Nero finish this item off.
Okay.
Go ahead, Councillor Bruni.
Thank you. I guess to Michelle, the $96,000 or 95.5, where's that money coming from?
To you, Mr. Mayor, to Councillor Bruni, I'd have to go into the report. I don't know offhand. If you want to wait, I can check that out.
No, you can send me an email if you want. It's no problem.
Okay, sorry I don't have that handy, and my internet connection isn't very fast, so it's hard to get to it.
Is that it, Councillor Bruni?
Yes, thank you, Mr. Acting.
Mr. Mayor, or anybody else on this item?
Yeah, thank you, Mr. Miro.
Councillor Shoemaker.
Thank you. Through you to Mr. Anderson. I noticed on Doug and Partners website, they provide services in both the French and English. Are we going to be marketing ourselves within Quebec in French as well?
Through you, Mr. Acting Mayor, to Councillor Shoemaker, that is certainly something that we will be considering. On a side note, there is some additional funding for not-for-profit tourism boards through the federal government that's being made available to assist with the offset of loss of municipal accommodation taxes. And we have been informed that, should we pursue some of those funds, there may be some federal requirements to bilingual marketing. So, it is something that we would be looking at. There has been, some indication that certainly some of the marketing growth, particularly for ATV and snowmobiling, could be looked at with the Quebec market. So it's something that we may wish to consider.
Yeah, I mean, I think it's especially important, if travel is going to remain restricted within our own country, that we market ourselves, to a quarter of the Canadian population in their primary language. So please have that discussion with them. That would be great. Thank you.
Thank you. Will do.
Is that it, Councillor Shoemaker? Anyone else?
I think that's it. 6.5, or you want 6? Go ahead. Sorry, Sandra. I thought you were done. Go ahead. Sorry, Rick.
No problem.
Just on this item, going back to Mr. Anderson, can you just quickly just touch base on, I think this is kind of off topic, but it's not. You're doing a campaign also with regards to in the Globe and Mail or other publications to promote the quality of life in our area. Is that correct?
Through you, Mr. Acting Mayor, to Councillor Hollingsworth. That is correct. Yes, we have done a few features, both with the Globe and Mail, Explore Canada magazine, and Canadian Traveler so far this year.
Okay, and that's an ongoing campaign as well, which will be running at the same time that once this group starts to run, right? I mean, it's going to be another reach out to other areas, right? Is that correct?
Yes, we will continue that work in terms of new resident attraction and continuing to market the quality of life and the value that Sault Ste. Marie offers. So that will continue. We will be engaging this group in some of that dialogue as well in terms of how to optimize some of our campaign work and really look at the medium in which we're pushing out some of these attraction campaigns.
Okay, great. That's so exciting. Thank you.
Thank you.
Okay, that's it for 6.5, Council. So back to you, Mr. Mayor.
Hey, Councillor Beзвell, your next item.
Yeah, next item is 6.8, and probably Mr. Ver, the Rainbow Crosswalk. Mr. Ver, in the report, it says staff considered a number of different locations for the Rainbow Crosswalk. It is an initiative that you've seen in other communities. My question is, has the LGBTQ two-spirited community been contacted? Have they been consulted either through the club at Coach Katrina that does a youth group, members of Sioux Pride as to their thoughts and considerations for this Rainbow Crosswalk?
Through you, Mr. Mayor, to Councillor Vezawalan, yes, staff did outreach to members of the Sioux Pride community. to talk about the location and potential locations for the Rainbow Crosswalk.
Is there a report that's based on that interaction? Or any testimonials or?
Through you, Mr. Mayor, to Councillor Vezowalan, there wasn't a report. It was really, a dialogue and a series of conversations that we had that led us to that location.
Okay, thank you, Mr. Mayor. I would like to see, a letter of recommendation or support from the community, because I've received messages that were not in support. I'm really questioning this initiative at this point, but that's it for questions right now for me.
Okay, Councillor Gardy.
Yeah, I haven't received any information as much information about it from the community as Councillor Vezowalan has, but I think it's a good initiative. I should be placed where we see it best fit for our community. But I had a question about the price tag, to be quite honest. It was at 13.3, I think. Through you, Mr. Mayor, to, I guess, Deputy CAO Ver. Could you kind of elaborate or give some kind of background as to why it would be so expensive? I just find it expensive. Maybe it's just me, but through you, Mr. Mayor, to Mr. Ver.
Mr. Ver?
Yes, through you, Mr. Mayor, to Councillor Gardy. Really, the cost of it is tied in with the materials and using the proper paint to put down the Rainbow Crosswalk. We did research looking at other communities across Canada and the costs that they were reporting when they did similar initiatives, and we found these costs very much in line with the price to do this type of work. If you do it with a lesser paint, of course, it's not going to last through winter season or last the length of time that it would if you use the proper painting for road work.
So would it be similar to any painting that you've done, any similar painting that you've done in kind of decorating the parking spots downtown? Is that the same type of paint, or is this a more substantial kind of material?
Through you, Mr. Mayor, to Councillor Gardy, yes, this is a more substantial type of material. This would be the type of paint you would use for road painting applications or cycling lanes, that type of work.
So when would you envisage having to reapply? Those 13.3 would get you to a few seasons, a couple seasons? Do you have any idea?
Through you, Mr. Mayor, to Councillor Gardy, I may have to defer to our colleagues in engineering on this, but from the work that we had done, people were looking at the potential for 3 to 5 years as a life cycle for this type of paint.
Cool, thank you.
Councillor Shoemaker next.
Yes, thank you, Mr. Mayor. Just on the cost issue of this, I just wanted to note that this is the least expensive thing that we're debating on our agenda tonight. So I think it's well worth the investment, and happy to see this moving forward.
Councillor Scott.
Thank you, Mr. Mayor. This is also to do with the cost, but not in the same way that you may think. But I did have that same question that Councillor Gardy had. Through you, Mr. Mayor, I'm not sure if it would be to Mr. Ver or to maybe Mr. Elliott, somebody that would be in the know on this. So how much does it cost to do an average crosswalk to paint it? And how long does that last? Do we use the same type of paint? Does it last the same amount of time?
We can have Mr. Ver or Mr. Elliott take that, but I think that Mr. Ver has indicated we're using like the high grade road paint that we would use for our crosswalks. Is that correct, Mr. Ver?
Yes, Mr. Mayor, that's correct.
So this would be the same kind of paint that we're using on our on existing crosswalks. So it'd be safe to assume that those would also last 3 to 5 years. Where I'm getting to this whole thing basically was, if we're using a different quality of paint, but we're not, it sounds like, could we have been using that on our existing crosswalks and save money by paying more upfront? But it sounds like it's the same. So basically that's where I was headed with that. If it's the same type of paint, then I'm A-okay with that kind of questioning.
Does Mr. Elliott want to confirm that?
Mr. Mayor, to Councillor Scott, I don't know what paint is being used here. I know there's thermoplastic, epoxy type paints that are used. Generally speaking, everything needs to be touched up at least annually. But I would assume that this would be a 3 to 5 year paint.
Great. That was basically my line of thought was that, you know, if we're using it for this purpose, which I think is a great initiative, then could we have applied it elsewhere? But it sounds like it's the same style of paint. So that's fantastic. I'm glad to see that we are doing it. And similar to what Councillor Shoemaker was saying, I mean, it's relatively inexpensive, and I think it'll add some color to our downtown as well as show support of communities. I would also like to say that Councillor Vezo-Allen was correct. I haven't had anyone personally reach out, but I wouldn't mind seeing some support from the community as well, because I would hate to misstep and assume we know what is best as a city when we're just kind of implementing it without getting any outreach.
Well, I think Mr. Vera's indicated there is outreach, but it is a city crosswalk, so we have to essentially select the crosswalk that it goes on.
Yeah.
Councillor Nero?
Thank you, Mr. Mayor. My question was asked.
Okay. Anybody else on 6.8? Councillor Hilsinger? Councillor, I can't hear you, Councillor Hilsinger, so just...
Oh, I'm sorry. Two things to hit. Okay. Thank you. I have a comment. Mr. Ver, I'd like to thank you very much for moving this initiative forward. I know it took a lot of work on behalf of yourself and a number of the staff at the community or at the city. I know just to allay the concerns of Councillor Scott and Councillor Vezo-Allen, I am aware, because I was told by some members of the Pride community that they were reached out to, and I know that they're very, very excited to see this representation and support for the community here in Sault Ste. Marie. I'm really proud of what we're doing. And thank you very much for making this a reality. It's really great.
Okay. I agree with everything that Councillor Hilsinger just said, so I won't say anything further. We can move on. Councillor Vezo-Allen, do you have any other matters in the consent agenda?
Only 6.15 to Mr. McConnell. Mr. McConnell, concerning the 100% of incremental increases that would be deducted from the Agua train station, does it go from when they were shovel ready, because the structure is almost completed, or does it go from us reporting at today's date? I know it's a max of 3 years for a max of $100,000. So that's my only question for you.
Through you, Mr. Mayor, to Councillor Vezo-Allen, the actual start of the rebate is when MPAC completes a reassessment of the building, because the amount of rebate is dependent on the increase in assessment. So that will not probably occur until next year. So next year would be the first full year where we would have those numbers once MPAC has an opportunity to reassess the building. It would run for 3 years beginning next year.
Okay, and they just continue to pay the tax rate of what they were paying before they were shovel ready?
That's correct.
Okay, thank you, Mr. McConnell. I have nothing further.
Anybody else in 6.15? Seeing none, we have next on the list I have here, Councillor Shoemaker.
Thank you, Mr. Mayor. I have a handful of items, actually more than a handful. I'll start with 6.1, which is the letter from the Municipal Affairs and Housing Minister. On page, I don't know, I guess this might be to you or to Mr. White. On page 2 of the letter, the minister states that Actually, this question's for Ms. Fields. The minister states that there will be new opportunities available for remote court attendances for municipally owned courts. Ms. Fields, will this reduce our cost in administering the Wawa court, the provincial offense court in Wawa? Or does it have the potential to do so?
Through you, Mr. Mayor, to Councillor Shoemaker, I can't speak to that. We're still in the, we're still working with the group, deciding what's happening, and so I really couldn't give you any information on that. My apologies.
Okay, well, I think there may be an opportunity based on, I realize these are broad outlines in this letter, but if there is an opportunity to reduce City of Sault Ste. Marie expense to administering the Wawa court, there would be some savings there to look at. The second question on this letter is also to you, Ms. Fields, and that is on the second paragraph on page 2. They talk about payday loan related changes. Do we know, or have we had any information on what the specific changes are and whether or not those will affect our payday loan bylaw that we brought in a year or so ago?
Through you, Mr. Mayor, to Councillor Shoemaker, I do not have details on that.
Okay, again, I guess that would be one that hopefully we can keep our eye on, see if they're assuming any of the costs that we're currently assuming by the administration of that bylaw.
Yes, we'll watch that.
Thank you. Those are my questions on 6.1, Mr. Mayor.
Anybody else in 6.1? Go ahead, Councillor Shoemaker.
Thank you. I've got item 6.7, the constitutional challenge to our non-construction employer designation.
Go ahead.
Through you to Mr. Nero. Mr. Nero, the request is for an additional or a limit of $100,000 for legal fees to defend ourselves against the constitutional challenge the carpenters have brought against us for selecting a non-bound company to perform work for the city. Is that correct?
Through you, Mr. Mayor, to Councillor Shoemaker, just to clarify, it's for the actual constitutional challenge that they've raised through the passing of Bill 66. If there's a little nuance there, I think.
Right, not job specific, but generally on
correct.
Bill.
Yes, correct.
And since Bill 66 was passed, is it accurate that one of our major projects, that being the West End Sewage Treatment Plant, came in $1 million under what we expected it to come in?
Through you, Mr. Mayor, to Councillor Shoemaker, yes, that's my understanding.
I was going to suggest that question is probably not for Councillor Nero. I think that CEO could direct that. So not Councillor Nero, I apologize. Peter Nero, I think the CEO could direct that, answer that question and direct it to the appropriate party.
Yes, thanks. I'd asked Mr. Nero, as I know he's been intimately involved with this file for a number of years, to collect that information earlier today. So I knew he had it, but I do appreciate that it's a bit outside of his regular scope of work. So, in my opinion, this is money well spent. We've saved $1 million already by not being bound. Obviously, we should have or could have assumed that a constitutional challenge was coming. Do we know, Ms. Fields, if the province and the other 2 municipalities that are affected by this legislation are pulling their weight, so to speak, in defense of this legislation as well?
Through you, Mr. Mayor, to Councillor Shoemaker. Mr. Nero has been involved with the case management process so far, but it's my understanding that all 3 of the municipalities are working together for a unified front.
And would that go for the Ministry of the Attorney General as well, Mr. Nero? Do you know?
Through you, Mr. Mayor, Councillor Shoemaker, yes, the Attorney General is also represented at the table. And as you can imagine, there's also an intervening party, the University of Toronto. So there is a 6th lawyer in the proceedings, but from my detailed involvement with the proceedings, equally shared of the heavy lifting that is required, but certainly a recognition that the representatives we have, our external counsel, are the lead knowledge-based firm in this type of labor law. And even the Attorney General would acquiesce to that expertise. So we are in a good place. Nothing is guaranteed, but we are certainly in we're in good hands to see the challenge through.
Thank you, Mr. Nero. As I noted, I think this is money well spent. I think in the long run, not being bound, it's already saved us as much as $1 million. I think we're going to save much more when we are successful with this constitutional challenge, as I am confident we will be. Thank you, Mr. Mayor, on this issue.
Anybody else in 6.7? Nobody else in 6.7? Okay, go ahead, Councilor Shoemaker.
Thank you, Mr. Mayor. 6.11, the Northern Transfer Point to Mr. Lamming. Mr. Lamming, at the open house that was held at Sioux College, a number of residents of Sharon Crescent and Tadcaster Avenue were concerned that this exit, which will now be more frequently used because buses will be added to it, was slightly offset from the exit of their subdivision. So can you, and we were told that at that meeting that exit would be closed off by Sioux College in the future and an exit further down the road would be used. Can you confirm that's still the case?
Through you, Mr. Mayor, to Councillor Shoemaker. Yes, that was brought up at the open house, and through coordination with the consultant and our engineering department here in the college, there will be a new entrance that will be going forward adjacent to the college residence, which will provide access to the rear parking lot and the staff parking lot, therefore removing the majority of the traffic, which will allow for the transfer point to focus on buses, but it will allow for a drop-off area to access one of the main points of the building still. That being said, that this could have still taken place with that traffic, but it was felt with the college and that to install that new access point as well, as you noted.
So does the fact that it's, perhaps this is a question for Don Elliott, does the fact that it's slightly offset with the intersection for Tadcaster Avenue, does that create any risk from an engineering perspective?
Mr. Mayor, to Councillor Shoemaker, the offset in that situation is very slight. I don't think it's I wouldn't be concerned about it. I don't think it's an issue, especially when the bus traffic, because there's only going to be 10 or 12 buses an hour and no cars, very few cars coming out of there.
So not a significant risk factor from your perspective?
No, it's not.
Okay, thank you. That's all on that. That's all on that item, Mr. Mayor.
Councilor Dufour, you have a question on this item?
Yes, I do. Thank you, Mr. Mayor. I believe this would be for Mr. Lamming. Mr. Lamming, obviously these route changes that are outlined in the report won't be taking place until after the commissioning of the Northern Transfer Point. Do we have a rough idea on when the targeted date is for that? Is it for the end of the summer, mid-fall? Can you give us a sense of when that's going to be happening?
To you, Mr. Mayor, to Councillor Dufour, we're in the midst right now of actually finalizing the lease agreement with Sioux College. We anticipate that to come forth either the next meeting or the following one in September, with hopes of building either late summer or early fall. Hopefully that answers your question.
It does. So in your report, you outlined some route changes, and the report is, it seems to me, presenting these for information and inviting public comment. Is that accurate?
To you, Mr. Mayor, to Councillor Dufour, yeah, as a part of the original outreach, we've had numerous sessions for consultation, and as kind of stated in the report, we wanted to share these route changes with the public here this evening, and we're always willing to take suggestions at transit. These are the suggested changes that we've had from ongoing discussions way back when it was Transit Consulting Network that did state that this is the most viable spot for a transfer point, given this location, and also in addition to the increased ridership at the college, which is essentially doubled. So this is an excellent opportunity to partner with the college in our highest growth area and where the consultant stated it should be.
Thank you. And can you just speak briefly to some of the the metrics that are being used to evaluate the new routes, such as what are going to be the measurable advantages to having the northern transfer point? Like what percentage routes are going to be faster through the community, for example?
Yeah, through you, Mr. Mayor, to Councillor Dufour, some of the main things that we're looking here that we're very excited about is more direct service and service options from this transfer point, so you don't necessarily have to come down to the downtown terminal. So we'll be looking at time served from having potentially a half an hour service as potentially an hour service, because you're able to go right to the transfer point and have 4 or 5 options right from there to access any point within the city.
Okay, thanks. And just one final question on the new routes, just from my reading of them. I was curious as to what was the logic behind having the Riverside route service the industrial court and having the Great Northern route service Bay Street. I was just curious if staff had given some thought to just kind of the discordant names a little bit there, and if there might be a way to make things a little clearer for the community.
Through Mr. Mayor to Councillor Dufour, yes, every route we measure based on time and where it needs to arrive at end destination. So that's why we've tweaked certain routes to replace covered by others. And all routes there on these 4 right here are going through the northern transfer point, which also catch key areas near St. Mary, Superior Heights along the way that potentially didn't before. So that's where there's been tweaks, but all the same areas that were covered in the past continue to be covered moving forward.
Okay, thank you very much, Mr. Laming.
Okay, so on the same item, Councillor Gardy.
Yeah, thanks. I'll be quick because Councillor Dufour asked a couple of my questions. I think we're going to be well served by the additional transfer point. Mr. Laming, as I read it, I was impressed by the extent of consultation that went into our optimization plan. I'm excited that it's nearing completion. I was wondering if you could just kind of review quickly for the public the extent of that consultation, kind of writ large as it relates to the plan.
To you, Mr. Mayor, to Councillor Gardy, happy to do so. There was 8 transit focus groups, 8 public open houses, 3 online surveys, 1,208 responses to the surveys, 900 comments received, plus an open house last year for the Northern Transfer Point itself. And we continue to take suggestions as we move along.
Now, and I may have missed it when you just stated, but there was the opportunity for those that work at transit and drive, some of them to provide some input into this?
You, Mr. Mayor, to Councillor Gardy, yes, that's a great point. Of our 60 drivers, I believe we're now at over 30 that have actually driven the routes as part of their input into the process, and also to give some future training so it's not all done at once 2 weeks out. We like to make sure that people are comfortable, so we do that in advance.
Thanks, glad to hear it. Nothing else, Your Honor. Your Honor. Now he's a judge. Your Worship.
Yeah, okay, nice. Put your head, Councillor Gardy. Anybody else in 6.11? Seeing none, Councillor Shoemaker, do you have anything else?
Yes, Mr. Mayor. 6.19, the West End Sewage Treatment Plant declaration. Through you to Mr. Elliott. Mr. Elliott, for a project that is anticipated to cost $200,000, engineering fees of 25% of the total cost seem kind of high, just under 25%. Can you explain why the engineering fees would be so high for such a small fix?
Mr. Mayor, to Councillor Shoemaker, the engineering fees for a project as small as this, the percent tends to go up. If you're tendering a project, and there's some design functions, et cetera, tendering and contract admin functions that are standard for every job. So if you look at our associations, they'll suggest that you don't even use a percentage for engineering fees for projects less than 500,000. Our experience is that engineering as a percent of a project really does go up the smaller the project, but you still get a lot of value in, we're dechlorinating water here. There's legislation involved. We're quite comfortable that this is an engineering fee that's appropriate for this project.
Okay. If the recommendation is that we're not supposed to benchmark it as a percentage of the contract until it hits 500,000. What would the benchmark be at 500,000?
Mr. Mayor, to Councillor Shoemaker, the one report that I was referred to, from 500,000 to $1 million, it's more like 23%. So by and large, your engineering rates in this area tend to be lower than is recommended, and that's been the case for many years.
Okay, that's all on this item, Mr. Mayor.
Okay, anybody else on 6.19? Seeing none, anything else, Councillor Shoemaker?
Yes, thank you, Mr. Mayor. 6.18, the miscellaneous paving contract.
Go ahead.
Clarification on this report. It lists a number of roads that are to be repaved. This is through you to Mr. Elliott, a number of roads that are to be repaved. And then it talks about various surface treatments within the municipality and Prince Township. So for what reason would we be including Prince Township contracts in our miscellaneous paving tender?
Mr. Mayor, to Councillor Shoemaker, for a number of years now, Prince Township has piggybacked on our surface treatment program for an economy of scale. It's to their advantage and slightly to our advantage as well to make the project bigger and more attractive to contractors that do this kind of work. So they contribute, or they'll put a couple of streets in their program into ours. We tender it for them. Our contractor does it for them. They completely reimburse us for that, and they also pay us mileage and a prorated amount of money for contract administration and inspection. It's something we've done with Prince for several years now, and it's worked well.
Councillor Bruni on the same issue.
Yes, Mr. Mayor, just more of a comment. The miscellaneous paving, I did some homework. We are going to be doing 2.85 kilometers at $1.7 million. And out of that 2.85 kilometers, 1.95 kilometers is for of 2-lane roads, which is milling and resurfacing, and 0.9 kilometers of 2-lane roads is surface treatment. I guess a question to Mr. Elliott, surface treatment meaning, would you be able to explain the surface treatment?
Mr. Mayor, to Councillor Bruni, surface treatment is our Class C road surface. It's not asphalt. It's a tar and chip. There's 2 layers of hot tar that go down, followed by stone chips. It's not the best surface, but it does work, and it's much less expensive than asphalt.
And this is not in the city; it's more outside in the rural areas. Would you use it more so, or?
Mr. Mayor, to Councillor Bruni, yes, on low volume rural settings, surface treatment has been a cheap way for us to put a surface on it. We do have some roads right within the city that have surface treatment. We'd rather they be asphalt, but they're still surface treated.
Okay. Thank you very much.
Councillor Shoemaker, were you done on that item? I thought you were, so that's why I went to Councillor Bruni. Okay. Anybody else on 6.18? Councillor Shoemaker, do you have any more items?
2 very quick ones. 6.13, the rental housing incentive program, through you to Mr. McConnell. Mr. McConnell, the request is for a 2-year extension of this program. It seems like it's been very successful. I'm wondering why we don't make it permanent.
Through you, Mr. Mayor, to Councillor Shoemaker. The intent of any community improvement program is to provide an incentive to accomplish a specific objective. Here, the objective is to encourage the development of more additional rental housing. By making it for 2 years, and I mean, there's nothing special about that. We could have made it 3 years, 4 years, up to 5 years. But it gives council an opportunity to review the success of the program in 2 years to see if it's still necessary, if the incentives are appropriate, or if they should be increased or perhaps removed entirely. So that's the way the legislation was designed, and that's the program that we have followed in the past, hence the 2-year extension. With that 2-year extension, this program will have been in effect for 7 years, but you're right, it has proven to be quite successful.
Okay. You know, I don't, like you said, it doesn't seem like there's any magic to the 2-year number. I anticipate that in 2 years it'll probably be extended again. But you know, if that's the way that you see fit going about it, that's reasonable.
Yeah, anybody else in 6.13? Councilor Bruni. Councilor Bruni, you're not off mute yet. You got the Matt and Marchie show going.
I'm sorry, I was talking to myself.
Yeah, no problem.
To Mr. McConnell regarding the rental housing incentive, is this for new builds only, or is it for conversions also?
No, it's through you, Mr. Mayor, to Councilor Bruni. It is for new builds. You must create at least 4 units with at least a $500,000 investment. Because the value to the developer is based on the increase in the assessed value of the property. We have looked at conversions, and we will. The report before council tonight is only to recommend giving notice that council. There's a required public notice, and then council will consider this at their August meeting. But one of the things that we have looked at, and we will discuss this further in our report in August, is making it available to conversions. That is a better way, possibly a more successful way to create more low-income housing rather than just new builds. So that will be part of the discussion that will be available for council at their August meeting.
Okay, thank you very much.
Okay, anybody else on 6.13? Councilor Shoemaker, you have one more matter?
One more, Mr. Mayor, 6.9, the Norgoma sale agreement. Not even a question. I just wanted to thank staff on this one. I know that a lot of people put in a lot of work on this file over a lot of years. And for the last 6 years, basically nonstop work on it. So I said previously that the ship had a much greater connection to the Manitoulin Island Tobermory route. And I am happy that it is headed back there and that it is off our agenda with some finality.
Yeah, I want to reiterate Councilor Shoemaker's comments. Staff worked very hard on this. If the deal is completed and the ship leaves under this business person's care, it will be a good end to this story. I think council really did the right thing here in making the decision it did. I think it was the right thing for our downtown. I think it was the right thing for our waterfront. I think it was the right thing for that ship. And I think it's going to a place that it's has a much better chance of being a more significant tourism asset, and it will actually have a life there. So I'm glad to see that. None of that would have happened without staff's diligence and staff's hard work on this. So we need to recognize staff. And I want to thank council for having the foresight and the fortitude to make that decision. It was the right thing to do. On 6.9, Councillor Hollingsworth.
Yes, thank you. I echo both of your comments, and I do have one quick question for Mr. Ver. A couple of constituents have contacted me, and they just want confirmation that it's going to be how is it going to be used? Do we know the business person, how they're planning to use the ship? Rumors are going around that it's going to be a dive site. But Mr. Ver, can you comment?
Through you, Mr. Mayor, to Councillor Hollingsworth, I can confirm in talking with the folks from Tobermory Real Estate Investors that they do plan on operating a business out of the ship above water. And so it will be, an opportunity for people to go on to the boat and visit it in its next iteration.
Okay. And correct me if I'm wrong, the business that is going to be doing this has been there for many, many years. I think well over 10 years. It's a well-established business, correct?
Through you, Mr. Mayor, to Councillor Hollingsworth, that's correct. Yeah, they have deep roots in the community.
Okay. Thank you. Again, I appreciate it. I just received a few phone calls from constituents. Thank you.
Okay, so good work on that, especially to you there, Tom, and your team. So thank you. Councilor Shoemaker, that's the extent of your matters. I have Councillor Gardy, and then Councillor Scott. Councillor Gardy, what matters on consent did you have?
Mr. Mayor, we haven't canvassed 617 yet, have we?
No, we have not.
I don't believe you. I believe so. Okay, thank you. Through you to Ms. Hamilton Beach. Ms. Hamilton Beach, I think this is a nice opportunity to take advantage of, and I was wondering if you could give a brief overview of the grant funding program from the Federation of Canadian Municipalities, please.
Actually, it's myself, Larry Gerardi, Councillor Gardy, but I can certainly tell you how this all began and what brought us down this road. Finance Department had identified that there was a funding opportunity. We looked at the funding opportunity. It lines up quite nicely with this program and getting the fleet management review done that Council had requested. So basically, we've submitted, and unfortunately, it's going to be a little time before we hear about it. So we may not be able to have this in place for the 2021 budget process, but it'll be ready to go, and we're hopeful we're successful, and it'll be ready to go for the 2022 budget process.
Good work, thanks.
Okay, very good.
Hey, Councillor Bruni on the same matter.
Thank you, Mr. Mayor. I guess the question to Mr. Girardi, if you're not successful in receiving the funding, will this be put on hold again?
Through Mr. Mayor to Councillor Bernie, no, we will be originally we were going to be taking the funding from our equipment reserve, and we would have done that, but fortunately a funding opportunity came up. So it won't be put on hold. We'll be moving forward with it just the same.
Thank you.
Okay, anybody else in 6.17? Do you have anything else, Councillor Gardy? Councillor Scott?
Thank you, Mr. Mayor. Actually, that was the one I was going to bring up. And between both Councillor Gardy and Councillor Bruni, both my questions were asked. So I'm good. Thanks.
Very good. Nobody else has anything on consent? We've got everything, but only a few of them. So I think you covered the bases tonight. Madam Clerk, did you already read the consent motion, or do we have to do that now?
I will read it now. I have a motion by Councillors Dufour and Bruni resolved that all items listed under date July 13, 2020, agenda item 6, consent agenda be approved as recommended.
All in favor? Consent is carried. Thank you. That brings us to 7.4.1 Bylaw Enforcement Task Force. Council, you have a report in front of you. Mr. CAO, I don't think we were receiving a presentation on this, are we?
Yes, you are, Mr. Mayor.
Yeah, that's right. It's right here. So we'll pull that presentation up, and who is doing the presentation?
Mr. Elliott.
Very good. Mr. Elliott, floor is yours.
Thank you, Mr. Mayor, members of council. The report before you this evening under this item is a report from the Bylaw Enforcement Task Force. As background, next slide, please. As background, the Bylaw Enforcement Task Force was formed by resolution of council in June of last year. Given the level of frustration, council was seeking ways to expedite bylaw enforcement as a way to have faster action on derelict properties that need attention. So Mayor and Council and senior staff recommended a task force be formed. The 3 members of council, agencies, various agencies and staff representation to see if we could meet some common goals. Next slide, please. Councillors Nero, Dufour, and Vezo-Allen, staff from Legal Division, Public Works, Engineering, and Building Divisions got together. We also had representation from DSAB, and also Police and Fire Services were at the table. So we had a lot of agencies, a lot of staff. It was good discussion, good ideas, and a real spirit of cooperation. Very respectful process, I thought. And the discussions, they really fell under 3 broad categories. So we have the next 3 slides are the recommendations based on enforcement, resources, and the third is communications. So next slide, please. We had 4 recommendations under enforcement. The first one, we felt it was important to map the process that we have. Write them all out with anticipated timelines. And our view here was to streamline the process as much as we could, but stay within legislated periods and legislated periods for action and appeals. We do have some restrictions. There are some time sections that we can't make any changes to. Probably the best, or probably the most important recommendation here is to strike an ongoing task force, just a smaller group, a little more focused group to address repeat problems and help assemble an inventory of potential units for the DSAB Affordable Home Ownership Pilot Program. Another couple of recommendations. One was for procurement. We found that the low value threshold was a little low in our procurement policy of $2,500. So the recommendation this evening is to increase that to $5,000, and also an informal quotation process from $15,000 to $30,000. It was agreed that that we could speed things up from our end if those thresholds were changed. And finally, under enforcement, an amendment to the property standards bylaw to give us more regulation with respect to vacant buildings. Other municipalities have vacant building bylaws, and we feel that we can, just for clarity there, that is not, the new bylaw isn't recommended for approval this evening, but the intention is that the group moving forward will recommend changes to that bylaw. Next slide, please. Under resources, we completed an operations review of the building division, and we feel that building inspection, 5 full-time equivalents and 2 full-time equivalents in bylaw enforcement is sufficient. However, we think there are times when we could really use a 3rd bylaw enforcement officer, and we were requesting, referring to the 21 budget, a operating increase for part-time bylaw enforcement officer. Also, I think anything with a geographic attribute is worthy to look at GIS applications. So we are working with the Innovation Center and IT staff for GIS applications. And finally, under resources, we do intend to develop more performance indicators to track our progress. Next slide, please. Finally, under communications, we want to enhance and increase communications internally and externally. The building division has a complaint tracking system that most of council is probably aware of. It's address driven. In my view, it works very well. The councillors have access to it. We now have legal has access to this, and they can update it when a file is referred to the court system. The legal department can put the dates in and status, which is very helpful as well. Clearly, for this to work as well and better in the future, it must be updated regularly. And my experience has been when I see a complaint come in, the guys are very good in the field to, if they look at it in the morning, it's very often that you'll have results on it, you'll have a status and pictures and everything else so that you can see what's going on at that property and that day. But we do emphasize to staff that this must be kept up to date. And finally, under communications, we intend to take our process maps once they're finalized and put them on the city webpage so that anybody who needs to know what we do or is interested in the process can see the flow charts. So if council approves these recommendations from the task force this evening, then the work can proceed now with the smaller task force to start its work and we can move on. So that's what our hope is this evening. Next slide, please. I thank you for your attention. I certainly thank the outside agencies for their time. It's hard getting so many people together. Councillors, really good input on this committee. And we look forward to the future. Also like to give a little shout out to the bylaw enforcement employees themselves. It's my opinion that they have, sometimes they have some pretty tough days. They see some pretty tough things. So just a little shout out to them as well. So I'm available for questions. Mr. Mayor, Fred Posibon is on as well. And I believe there's councillors that may speak as well. Thank you.
Okay, so before we get into this, and I started a list, Councilor Shoemaker, I see your hand, I'll add you to the list. Councilor Gardy, I already have you. Mr. CEO, are we looking for a resolution tonight to appoint 2 councilors to this? Is that part of what we're doing here?
Yes, Mr. Mayor, I think it behooves us to move as quickly as we can on this item. So I would look to appoint the councilors to it.
So let's deal with that after we answer the council questions. So first we'll go through, answer any council questions. When we're done that, we'll take names and see who wants to be on this and go from there. So I have a list. Councilor Gardy, you're first, and then Councilor Shoemaker.
Looks to me like Councilor Gardy's frozen, Mr. Mayor.
Yeah, it does. So let's go to you, Councilor Shoemaker.
I was only putting my hand up to volunteer for that committee, as this is a work that I'm deeply interested in. I didn't get on the task force initially, but I'm eager to participate in this if council will have me.
Okay, so we'll get to that in a second. Let's first deal with the substance of the report and any questions we have for the task force. Then we'll circle back to the committee after that. Does anybody have any, Councilor Gardy, you're back. We'll start with you. Do you have any questions or comments you want to make on this?
Yeah, quickly, Mr. Mayor. I appreciate the work of the task force. I know council was well represented by the 3 individuals who were on it. It's been my experience that over the course of the last little while, I've seen a real kind of uptick in what's going on in and around bylaw enforcement. I am very pleased with the work that the enforcement officers are doing. Mr. Elliott mentioned how they're very timely in updating the system. Not only do they do that, but I've had experiences where not only have they updated the system, but they give me a call to let me know how their visit went to a particular location. I really appreciate that, them taking that time. Mr. Elliott had mentioned that, the recommendation for a vacant properties bylaw to be returned to council. Through you, Mr. Mayor, I was just wondering when, Mr. Elliott, through you, Mr. Mayor, to Mr. Elliott, when could we anticipate that coming back to council? Because I think it's of vital importance in this area.
Mr. Mayor, to Councilor Gardy, I'm aware that Fred is already working on that. We have samples from other municipalities. So I was talking to him today, and our intention is to bring a draft to the first committee meeting, or the first meeting of this next task force. So we should be able to turn that around fairly quickly.
That's great news. You had mentioned coming to council about some part-time help in bylaw enforcement. I'd like to let you know that you'd have a partner in me in that regard. I think it's important. We made a lot of strides in and around the community. Hopefully residents have noticed that. And I thank you for the work, and I look forward to that bylaw on vacant properties, because we got one in the West End that Councilor Scott and I are ready to hop all over, which we won't mention yet. Thank you.
Okay, I have Councilor Dufour and then Councilor Bruni.
Thanks, Mr. Mayor. Having been very heavily involved in the task force, I don't have questions at this moment, but I would like to make a few comments for the benefit of the community. One of the most important things that I wanted to share is that this is the number one issue that I hear from constituents on. This is the number one thing that is on people's minds. It affects how our city looks. It affects very directly the quality of life for many of our citizens all across several neighborhoods, as even Councilor Gardy and Councilor Scott have previously alluded to. I think that this is a great example of how council and staff can work together to really tackle a problem head on and to take direct action against something. And I want the community to know that the adoption of this ongoing task force and of this report is really just the beginning of what is available to this council and to us to really affect the changes that we need to see in the core makeup of what is our city, and that's our buildings. Bylaw enforcement, it may not be the prettiest element of the city services, but I think it really is one of the absolutely critical ones, because in its absence, our city does not look its best, and our citizens suffer greatly for it. And so I would like to encourage all of my peers here on council and the community at large to adopt these recommendations and to continue to support the work of the task force going forward. Like I said, I believe it plays a critical role, and I'm very happy to see that the DSAB and their programming through the Housing Corp have been incorporated into the overall vision of how we plan to tackle this problem. So thank you very much for all your work, Mr. Elliott, and all the other city staff that have supported it. Thank you.
Councilor Bruni, you're next.
Thank you, Mr. Mayor. Just one quick question to Mr. Elliott. Regarding enforcement, did the committee discuss the length of time when say the homeowner has been notified, and what is the time period that, for instance, if it's a high grass, garbage in the yard, did discussion occur regarding the length of time that the homeowner has to clean it up before any action is taken?
Mr. Mayor, to Councillor Bruni, the general discussion was how to speed all of these things up. So did we get into the specifics of dirty yards? Essentially, no, but we're mapping the processes out, and we are doing everything we can to speed up all of these processes to resolution.
Mm-hmm. Because that's one of my concerns, that especially when a resident calls you regarding a neighbor with high grass, garbage, the garage is tilted one way. I just find that it takes a good period of time, and before you know it, summer is over. And I was hoping maybe this committee would be able to discuss like a time period, like in 30 days, we should have the problem resolved, that city staff hires a company to go in and clean the yard up, and it's put on the taxpayer's bill. I guess that's my concern.
Councilor Nero?
Thank you, Mr. Mayor. Just a comment. I've been involved in pushing the dirty yards bylaw and the property standards bylaw with council for a number of years. And we've taken over the years, even with the previous councils, we've taken small steps, and we've changed the bylaw, we've revised it. We've taken steps to change the amount of time it takes to make properties come into approval with the bylaw. This one is a big step, so I want to thank the committee that we took these steps, and we're putting this into place, and I hope council approves this. The problem, as I see it, being involved over the years, has always been the legal aspect to the amount of time it takes to make properties comply to the bylaw. So, there are things that we can change internally in the steps with going in to do the work, but there are hurdles that are going to continue to be in our way. And those I see as the legal steps, where we have to allow a certain amount of time for the properties to become compliant. So I'm happy with the steps that we've taken to date, and I think this is going to make some significant changes to the property standards bylaw again. And I think there's going to be a significant change that we'll see in the community as a result of this. So thank you very much.
Any other questions from council? So before Councilor Vazuel.
Just a comment, Mayor. I just want to say that it was great to have all the organizations around the table, especially when you're looking at fire and police. And Deputy Chief McLaughlin is proposing bringing in the IMET, which is the Integrated Municipal Enforcement Teams. So it's everyone working together, especially in terms of derelict buildings, people living in substandard conditions. And so it was really that collaborative approach that I think we can definitely see a lot of good progress moving forward. And I just also want to thank Don and his team for really helping get all of this put together, and the council.
Yeah, so I'll just round that off and share my thoughts, and then it'll go to electing the 2 councillors for the committee. This was really important work, so thank you to everybody who participated in it. From the very beginning of this term, like it began last term, but from the beginning of this term, it was a clear message to me from council that you wanted to see improvement in this area. And it was a clear message that staff received from me. I think property standards in bylaw enforcement is an area that we can internally improve and do better. There are a number of vacant buildings around the city, old schools that are covered in spray paint, and frankly, we just have to have a higher standard, and we have to hold ourselves to a higher standard, and we have to hold our property owners to a higher standard. I think this work is a good start to doing that. I have confidence in staff's understanding the importance of this to council, the priority we place on it, and what it means for our community to do this properly, and I'm confident staff will. And I think it's positive that we're going to continue to work with staff and community partners to do this collectively and together, and we're going to elect a couple of you to do that work. I'm going to continue to support the work because I think it's a critically important initiative of this council term, and I think it's an area we could really improve on. So thank you to everybody who's contributed to date, but this is a beginning. And when we look around, we see we have lots more work to do, and I'm confident over the next 2.5 years of this term we'll do that work. So I need to indicate, if there's more than 2 of you who want to sit on this, we're going to have a vote, and we'll have the clerk and the CEO walk us through how that's going to happen virtually if we do have to have a vote. But before we get to that, we have Councillor Shoemaker's expressed an interest, Councillor Nero's expressed an interest, Councillor Dufour's expressed an interest. Does anybody else have an interest in sitting on this? So we have Dufour, Nero, and Shoemaker. Any other parties that are interested in sitting on this? Okay, so there's 3 of you. So we have to, how is this going to work, Mr. CEO? We're not able to cast ballots. I imagine we each get 2 votes. How do you want me to go around the horn and ask everybody individually who they vote for? Is that how you want this to work?
Mr. Mayor, if I may, Rick?
Yeah.
Is there a problem in having 3 councillors on the committee?
Mr. Mayor, I was just going to suggest that to you. We did discuss how this might go earlier on today, just amongst staff. We did look at the composition of the task force, and you could increase the number of council by 1 to have 3 councillors on it and still maintain the integrity of the task force.
Okay, so we don't run it yet. That doesn't create any rules with the open meeting provisions of the Municipal Act, I take it.
That's correct.
Okay, so nope, there's no election necessary then. If the 3 of you are interested and council is interested in making it 3 councillors in the committee and are comfortable with all 3 of you, we'll see a show of hands in that respect as consensus, and that can just move into the report. Okay. So do we need to read the resolution on this, Mr. CEO?
Yes, there is.
Okay, if we can have that, please.
I have a resolution by Councillors Vezo-Allen and Nero, resolved that the report of the Director of Engineering on behalf of the Bylaw Enforcement Task Force dated July 13, 2020 be received, and the recommendations that staff be authorized to proceed to map processes with anticipated timelines for property standards, yard maintenance, sewer use, and drainage agreements on title. Strike an ongoing task force comprised of 3 members of council, Councillors Dufour, Nero, and Shoemaker, building engineering, legal, and DSAB staff with assistance from police and fire services when required, to meet regularly to address repeat problems and regularly review processes for continuous improvement in expediting enforcement, and assemble an inventory of potential units for the DSAB Affordable Home Ownership Pilot Program. The task force to meet at least semi-annually. Amend procurement bylaw 2016-143 by raising the current $2,500 threshold for low-value purchases to $5,000 and the current $15,000 threshold for informal quotations to $30,000, amended bylaw to follow at a future council meeting for approval. Amend property standards bylaw 2012-09 to enhance the regulation of vacant lands and buildings, amended bylaw to follow at a future council meeting for approval. Request an operating increase in the 2021 budget for a part-time bylaw enforcement officer. Develop GIS applications for mapping and monitoring trends in the geographical components of enforcement. Develop more performance indicators to track successes and identify areas for improvement. Enhance complaint tracking systems so that updates can be entered by the legal department as well as the building division to improve internal communications for all parties, and publish all process maps on the city webpage to enhance external communications. And that is open for vote.
Okay, all in favor? Resolution's carried. You can cast your vote, please.
That takes us
Okay.
to agenda item 8.1.
Okay, so we will have Councillor Hollingsworth. This is your resolution. Would you like to speak to it?
Thank you. Thank you, Mr. Mayor. First of all, I want to just outline how this came to our attention. A young constituent, the age of 9 years old, I believe, wrote a letter to our mayor. And he is a person that frequently uses Finn Hill along with his friends. He is a well-known sledder in the wintertime, and he basically felt it was time to contact the mayor and some of us councillors to see if we can improve on Finn Hill. And he took it upon himself to sit down and think through several different ideas. And the ideas were basically well thought out. It wasn't just an idea, but also solutions. So for our young constituent, I just want to say thank you for taking the time to jot down your ideas on a proposal. And I also want to say thank you to Councillor Hilsinger, Councillor Christian, Councillor Shoemaker, and of course you, Mayor, to help us listen to this young constituent. And there's basically, it boils down to that he has several ideas from, there's no signage right now on Finn Hill. He was also concerned about accessibility for all. Accessibility with regards to those that may have a physical handicap, and they should also be able to enjoy the hill. He also was talking about a possibility of a warming hut. Is there a chance where there could be some type of shelter where people can get warm while they're enjoying sledding? He also suggested that maybe we can look at making the hill a little bit more challenging for the older tobogganers, sledders. So the other ideas are quite in depth, and it's in his proposal. And at this time, I and my colleagues are interested in hoping that the rest of council will support staff to dive into looking at these ideas and hopefully consult with this young constituent and come back with a report of further recommendations on how we can enhance Finn Hill. Councillor Shoemaker seconded, and I know he probably has further ideas. So that's all at this time for me.
Do you want to add anything, Councillor Shoemaker?
Yes, thank you, Mr. Mayor. Just that we should all keep the name Charlie LaChapelle Smith in mind. He's 9 now, but he's articulate, well-spoken, well thought out, active in his community, solutions oriented, as he showed us through his presentation that he did to Councillor Hollingsworth, Councillor Hilsinger, and Councillor Christian on his proposal. I think everyone, I know everyone's going to be impressed with him if he attends at the council meeting when these recommendations come forward to speak to them, which I'm certain he will. He blew us away, and it's a name that we're going to be seeing in the community for many years. I can tell.
Well, those are kind words. I expect Charlie's watching. So on behalf of council, I want to say hi to Charlie. I want to thank him for taking the initiative of reaching out to us and trying to improve his community, move a project forward. I expect council will support staff looking at this and reporting back to us so we consider it. And with that noted, I'll ask for a vote on the matter. All in favor?
Oh, I haven't read the motion.
Oh, no? Okay. Oh, sorry.
Not yet.
Go ahead.
It's okay. I have a motion by Councillors Hollingsworth and Shoemaker, whereas Sault Ste. Marie and the surrounding area offers fantastic all-season recreation for all ages, from hiking, camping, biking, skiing, and tobogganing, to name a few. And whereas children need to remain active throughout the day and year as a means to interact with others, explore their outdoor environment, and gain exercise. And whereas our community has a popular tobogganing hill known as Spin Hill, where families for generations have enjoyed sledding as a fun activity that has allowed
So Councillor Shoemaker's not frozen.
I'm here.
You're here. A majority.
And whereas council is open to hearing and discussing ideas that make sense, now therefore be it resolved that staff be requested to review input received and seek further input on potential improvements to Finn Hill, and that the recommended improvements be brought forward in a report to council. And that is open for voting.
Okay, so a lot of folks are frozen here, Madam Clerk, and I've been frozen the entirety of your reading that, including you actually. So I'm not sure what's going on with our connection or whether or not people are able to vote. It's not.
I just need Councillor Gardy.
Who else are you missing?
Bruni and Christian.
Reach the desk of Rick Nero. I'm not able to answer your call right now, but please leave your name, phone number.
Nero's answer machine's on. So Councillor Christian, are you in favor? Yeah. Councillor Bruni, were you in favor?
Yes, I was.
And Councillor Gardy, were you in favor? Okay, so it's passed unanimously. Charlie, sorry for the technical difficulties there, but it passed unanimously. And we'll have you back to council when this report returns. That brings us to 8.2. Madam Clerk, why don't you read the motion off the get-go so we could vote on it when we're done.
I've motioned by Councillors Gardy and Hollingsworth, whereas due to the COVID-19 pandemic, Canada and the United States agreed to close their shared border on March 21, 2020, and that closure, with exceptions, has been extended to July 21, 2020. And whereas Canada has managed to slow the spread of COVID-19 across the country, including our own community of Sault Ste. Marie and District of Algoma, and whereas the United States has not slowed the spread of COVID-19 and cases continue to grow in the United States at a much more significant rate than Canada, and whereas Canadians across the country, including here in Sault Ste. Marie, have made and continue to make many sacrifices to slow the spread of COVID-19 and minimize the risk to each other and our larger community. And whereas Mayor Provenzano has been working with his border city mayoral colleagues across Ontario to advocate for and support the continued closure of the Canada-United States border with the current terms and conditions, now therefore be it resolved that this resolution shall serve to support the federal government's decision to close the Canada-US border and to request that the federal government maintain its current position until the risk of the COVID-19 traveling into Canada from the United States is minimized, and there is objective data that indicates the growth and spread of the COVID-19 virus across the United States has slowed dramatically and is at a minimum consistent with the growth and spread of the virus in Canada. Further, be it resolved that this resolution shall serve to support the work that Mayor Provenzano has undertaken with his mayoral colleagues across Ontario and encourages that work to continue until Council directs otherwise.
Okay, Councillor Gardy, did you want to speak to this?
Sure, thanks, Mr. Mayor. I want to thank you for your help in crafting the motion, and I want to thank Councillor Hollingsworth for assisting bringing it forward. And I'm quite hopeful it's going to pass unanimously. The fact is that the United States continues to see a rise in several parts of the country. Some severe rises in COVID-19, specifically in Florida, Texas, California, and a few other places. And the United States doesn't seem to have any discernible strategy, nationally anyway, to combat the disease. Most likely because the country's led by, what I'd qualify as a buffoon. That's me speaking. Most recently, he's decided, the president of the United States, to take more time, attacking the credibility of one of his leading infectious disease experts rather than taking time to ensure that his citizens are protected. He seems more focused on winning a national election, and federally, the border is controlled by Mr. Trump and his administration, obviously. We as a country and as a province and as a community, our citizens have managed to navigate this pandemic with considerably more coherence and success than the United States. Those that reside in the United States, unfortunately, at this time, pose a risk to the people who live in our community, in our province, and our country. And those of us in the borders you have mentioned before are at risk most directly and most immediately. I encourage the work that you're doing, as the motion states, that you continue to work with your border city community mayors, and we work with their councils to let the federal government know, Mr. Trudeau and the ministers responsible, that we'd like to see that border closed for the foreseeable future, at the very least until there's demonstrable evidence of a national strategy, and in turn, cases in that country getting under control. Thanks, Mr. Mayor.
Councillor Hollingsworth, did you have any comment as the seconder of the motion?
I do. I just want to say that this is a good example of us as a municipality to not just focus on our own community issues, but to lobby at a higher level of something that is so serious to our community, but to Northern Ontario and to our province. We as a municipality is important, yes, to look at our issues, but when something does impact us directly and potentially in Northern Ontario, and it should be our role to lobby at a higher level, which we're doing with this. Second piece is that the FNOM board, which stands for the Federation of Ontario Municipalities of the North, they just recently also wrote a letter to Minister Blair, who is the public safety minister, and they also CC'd Minister Terry Sheehan and also Minister Clark, to say, yes, we also agree that from a Northern Ontario perspective, we want the board to continue to be closed for the reasons of safety. The third piece I want to mention, including FNOM has said this, and also others have sampled businesses in the Northern Ontario area. And even though, yes, there is an impact on businesses, the sample has come back to say that for the health and safety of our communities, even businesses have confirmed that they would like it to be closed. In fact, businesses have come back to say that their sales are doing well because people are shopping at home, staying in their local communities. So retail is actually at a positive right now. So the bottom line is I support this, obviously, and the feedback I've been receiving from different parts of the community, it seems that people are supporting this as well. So thank you.
Councillor Shoemaker.
Thank you, Mr. Mayor. I just wanted to note that I had some comments on this a couple weeks ago that were widely reported. And I did try and clarify those statements that I made a few weeks ago. I do support this motion. My statements were never intended to be that I supported a reopening of the border anytime soon. They were for some future time. And I think that this motion appropriately captures that we want the border to remain closed until a safe reopening plan can be established between the two federal governments. So that I hope clarifies my statements on this from a couple weeks ago. Thank you.
Thanks. Council, maybe I'll wrap this up and we can move on. I do want to make, one comment and just one recognition. With respect to the recognition, I want to just recognize our friends in Chippewa County and in Sault Ste. Marie, Michigan. We've always enjoyed a really close relationship with Mayor and the commissioners in Sault Ste. Marie, Michigan. And we recognize that we're a significant, important part of their community economy, just as they're a significant, important part of our community. So this by no means should diminish that. The work I've been doing and the positions that I've taken on this are not political at all and don't relate to any political positions or who might hold those positions. They're simply based on the reality of what has happened in Canada, which is that Canada has flattened the curve and slowed the spread of this virus. And what hasn't happened yet in the United States, which is the United States hasn't flattened their curve and they haven't slowed the spread of their virus. And we need to understand what the federal government's decision-making is going to be when it reopens the border. And we just really need to make sure that when they reopen the border, it happens at an appropriate time in a way that keeps the folks that live in our country and specifically that live in border cities safe. And that we minimize the risk that can be introduced by reopening the border. So that's the nature of my opinion and the work that I've been doing and that I'll continue to do. And I think it's important that we communicate with our friends across the river. And I've kept in touch with Mayor Gary. And it's important that we understand the federal government's thinking and what milestones it will set and how it will make its decisions. And we're trying to do that. And I'll continue to work with my border city colleagues to do that. So it'd be great to have this, as the resolution outlines, the position of the municipality that we want to continue to work in this respect. And frankly, I think we all want the border to be reopened, but we all want the border to be reopened at a time when it's safe for our community for it to be reopened. Everybody wants our lives to go back to normal, but considering the growth of the virus in the United States, considering the number of cases that are recorded on a daily basis, now's not the time. And we have to continue to encourage the federal government to keep it closed until it is safe to reopen it. If there are no other comments on that, we can call for a vote. All in favor? Motion is carried.
Agenda item 8.3, a motion by Councillors Hollingsworth and Bruni, whereas the Sault Ste. Marie Chamber of Commerce and the Burlington Chamber of Commerce have drafted a policy resolution that is supported by numerous other chambers and boards of trade across the province. And whereas the resolution has been submitted to the Ontario Chamber of Commerce to form part of its ongoing advocacy agenda for 2020. And whereas it is recognized that community-based economic prosperity comes from the retention and expansion of businesses that exist in the community and provide future job opportunities by investing in and expanding their market opportunities. And whereas the City of Sault Ste. Marie passed a long-term tax policy on November 21, 2016, and a long-term tax policy review on March 19, 2018, to address the tax ratios between the residential, commercial, and industrial tax classes. And whereas the Sault Ste. Marie industrial tax class has been subject to significant property valuations shifts affecting the allocation, collection, and shift of burden within the industrial class that has had a detrimental effect on the industrial tax class. And whereas it has been identified that the existing tax tools available to municipalities do not provide enough targeted relief to specific areas or types of properties to assist in mitigating localized tax impact resulting from significant reassessment valuations. Therefore, be it resolved that Sault Ste. Marie City Council endorses the policy resolution submitted to the Ontario Chamber of Commerce, which urges the Government of Ontario to honor its 2019 budget commitment to ensure a modern and competitive property tax system and to develop an action plan to respect Ontario's property taxpayers based on meaningful and thoughtful consultation and collaboration with affected stakeholders, including residents, business, industry, municipalities, and subject matter experts. And consider providing new revenue and or property tax mitigation tools and flexibility to municipalities in order to manage property tax burdens in a fair and equitable manner, address new economic paradigms, and to target relief to business property owners or tenants in response to local tax policy priorities and objectives, and address the significant disparity between residential and non-residential property tax rates for education tax purposes. Further, that a copy of this resolution be sent to the Minister of Energy, Northern Development and Mines, Greg Rickford, Minister of Finance, Rod Phillips, Minister of Municipal Affairs and Housing, Steve Clark, Northern Municipal Association, Association of Municipalities of Ontario, the Federation of Canadian Municipalities, the members of Provincial Parliament for Sault Ste. Marie, the cities of Timmins, Thunder Bay, Sudbury, and North Bay.
Okay, Councillor Bruni, did you want to speak to it? You're not off mute yet, Councillor Bruni.
Thank you. The city clerk basically read it all, but you know, it's to honor the 2019 budget commitment. That hasn't been done. Providing new revenue on our property tax mitigation tools and address the significant disparity between residential and non-residential property tax. And also, just to let you know, Burlington is signed on, but also other city councils in Ontario are passing basically the same motion resolution, so that more voices, the better. And it's good to support our Chamber of Commerce. So I'll leave it at that.
Okay. Councillor Hollingsworth, did you want to speak to it too?
I do. We as a municipality over the number of years have worked hard on understanding the tax base in our community. And we have worked hard in keeping our taxes low, but sometimes there's another part of the whole tax formula that's out of our hands. So this is an excellent way to voice our concerns. I support this, and I hope that we will have another chance to keep the ball rolling. And it's another, I just want to say thank you to the Chamber of Commerce and also to you, Mayor, for helping us put this resolution together. And we need to continue and have a very loud voice around taxes from not just our municipality, but as Councillor Bruni said, from other municipalities. Enough is enough. Thank you.
Thanks, Council. I'll just add one comment to this. I want to thank the Chamber for looking to work with us on this. There's two, when we talk about taxes, generally speaking, the conversation always goes to spending. And spending is important, and we have to make sure that we have our spending in line and our spending is appropriate. But the second part of this equation, which is a very difficult part, which is frankly, in my opinion, what gives our community the most problem.
Unfortunately, Mr. Mayor, we can't hear you.
Well, I don't have this muted. Let me just see.
I can hear you.
We can hear you now.
Okay. So I don't know where I cut out, but I'm just going to have one comment to this. I wanted to thank the Chamber for looking to work with us on this and bringing this to our attention and passing this resolution. When we talk about taxes, we constantly and frequently talk about spending. And spending is important. It's important that our spending is in line. It's important that our spending is appropriate and that we get value for our spending and that our spending is kind of benchmarked to other communities. And I think for the most part, we have done a good job on spending, although we can improve. But the real challenge and issue this community has is on the revenue side and on the assessment side. And the reality is that the taxation model for municipalities is antiquated, and it's not keeping up with the demands on municipalities. And there has to be a good look at the taxation model that municipalities are required to use. And I think what you're seeing, not only in Sault Ste. Marie, but in other communities, and obviously this is something that chambers across the province are talking about, is that the tax system is inadequate to address the demands on municipalities, and there's an inequity that's created in that tax system. We see it in our ratios vis-a-vis the residential and commercial classes, the residential industrial classes. So I'm glad the chamber is raising this. I'm happy that they're looking at the assessment side and the revenue side of our tax rates as opposed to simply the spending side. And I look forward to working with them on this. And I think it's a broader discussion that we should be having about how municipalities are funded. So it's good to be part of it, and I appreciate the effort they're making. And that's why I was assisting in this and helping Councillor Bruni and Councillor Hollingsworth turn it into a motion council to pass. So I hope council sees fit to pass it, and we'll continue to work with the chamber on it. So did everybody's cast their vote?
I need Councillor Gardy. And Councillor Christian.
Councillor Christian.
And Councillor Nero.
Councillor Nero, are you in favor?
I'm in favor. There's nothing up on the screen.
Nothing's up on mine. I'm in favor as well.
Okay.
As I.
I'm going to have to follow up with a few of you who appear to have lost your eScribe connectivity, but we'll track you down.
Okay, Madam Clerk, that deals with 8.3.
That takes us to bylaws. I have a motion by Councillors Duffer and Bruni. Resolved that all bylaws under item 11 of the agenda under date July 13, 2020 be approved.
All in favor? Motion carried.
Then I have a motion by Councillors Bezo, Allen, and Nero that this council now adjourn.
All in favor? Motion carried. Thank you, Council.